90% Obamacare match perversely means that in tough times, when states have to cut back, for every dollar they cut from that 20-something-year-old man, the state will only save 10 cents. But for every dollar they cut from the elderly or disabled, the state will save 43 cents of their share of the spending. Meanwhile, Medicaid expenditures for illegal aliens have also skyrocketed through a whole variety of categories: emergency services, qualified alien, or lawfully residing status, as well as through state-funded programs like in California, or by using loopholes like reasonable opportunity periods. In fact, the number of individuals applying and receiving Medicaid coverage through a reasonable opportunity period who were unable to prove their citizenship skyrocketed 400% during the Biden administration. And what's worse is states have taken advantage of abusive money laundering schemes under the guise of so-called things like provider taxes, state-directed payments, or intergovernmental transfers to bankroll even more expenditures for expansion adults and illegal aliens. Provider taxes allow states to draw down even more federal funds with little or no skin in the game. And while state-directed payments reward politically connected providers with Medicaid reimbursement rates sometimes above commercial rates. And despite it all, rural hospitals are in shambles. Medicaid expansion has crowded countless Americans out of private coverage, and if the remaining 10 non-expansion states were to decide to expand, it would push almost 6 million more adults from private coverage onto Medicaid. So as a result, in the first 8 years of Obamacare, hospitals' profits fell by 2/3 in Medicaid expansion states, and more than 70 hospitals have closed in those expansion states since 2014. That's why the big, beautiful bill, under which Medicaid spending is still growing by 33% over the next decade, created common sense Medicaid work requirements for these able-bodied adults. It addressed the abusive provider taxes and state-directed payments, closed loopholes that allowed coverage for illegal aliens, as well as created a $50 billion rural health reinvestment fund while cracking down on fraud, waste, and abuse. Obamacare's Medicaid expansion has left a trail of fiscal destruction. It's prioritized able-bodied adults over the truly needy, elderly, and disabled, and it rewards money laundering by states. That's costly and wrong. Thank you, and I'm happy to answer any questions.
Thank you, Mr. Bragdon. Our next witness is Dr. Brian Blais. Dr. Blais is the president of the Paragon Health Institute. From 2017 to 2019, he served as a special assistant to the president for economic policy at the White House's National Economic Council, where he coordinated the development and execution of numerous health policies. He received a PhD in economics from George Mason University. Mr. Blais, Dr. Blais.
Chairman Johnson, Ranking Member Blumenthal, and members of the committee, thank you for the opportunity to testify today. Because of a lack of options, my family with 5 children has been enrolled on an ACA plan for 4 years, so I've seen firsthand the real problems with the law. All government policies create winners and losers. Unfortunately, the Affordable Care Act created far more losers than winners. The ACA promised affordable, high-quality insurance, and it failed to deliver. Millions of people lost health plans they liked. Millions of families faced massive premium and deductible increases for worse coverage that included fewer doctors and hospitals. The ACA significantly contributes to rising deficits and unsustainable debt, leaving young families, their children, and future generations with higher taxes and inflation. The law entrenched an inefficient, insurance-dominated health sector with massive subsidies flowing straight from the Treasury to health insurance companies. Here are the basic economics. The ACA's regulations increase premiums for most people to decrease them for a small number. Subsidies were then needed so people could afford coverage that the government regulations had made more expensive. The underlying regulatory and subsidy structure leads to ever-escalating premiums and prices. Higher premiums create pressure for still more subsidies. And those additional subsidies only worsen the underlying problems, fueling the very premiums and price escalation they were meant to offset. If Congress wants to make health care more affordable, it must reform the structure itself, not throw good money after bad. In 2014, when the ACA's key provisions took effect, individual market premiums rose nearly 50%. From 2014 to 2016, premiums increased nearly twice as rapidly as employer plan premiums. The ACA's subsidies are ill-designed and inflationary. The enrollee's share of the premium is capped, regardless of the total premium. Because enrollees pay only a small slice of the premium, insurers face virtually no price discipline, giving them incentives to inflate costs rather than improve value. The ACA regulations drove higher costs. For example, under the medical loss ratio, insurers must spend a minimum share of premium revenue on medical claims. In other words, to increase profits, insurers must raise premiums. The ACA's essential health benefit mandates requires all plans to cover the same set of services regardless of what consumers want or need. These rules increased wasteful spending and premiums. COVID-era subsidy boosts resulted in fully subsidized coverage and led to massive fraud in the program. In 2025, there are 6.4 million people enrolled in fully subsidized plans who are not eligible, costing $27 billion. In 15 states, there are more than twice as many enrollees in fully subsidized plans than are eligible. Many of these enrollees were signed up without their knowledge or consent, victims of massive fraud schemes. A staggering 40% of fully subsidized enrollees used no medical services in 2024. Many of these zero-claim enrollees are phantoms. Federal taxpayers sent more than $35 billion to insurers for people who did not use their plan a single time. The ACA's subsidy structure, particularly with the COVID credits, incentivized small employers to drop coverage. The percentage of small employers offering a health plan has dropped by 1/3 since 2010. The ACA has also led some state and local governments to drop retiree health coverage, offloading that expense onto the federal taxpayer. The COVID credits, by lifting the subsidy cap at 4 times the federal poverty level, encourage early retirement. It has led to situations like a retired couple in their mid-50s who earn $136,000 in pension income from government service, receiving $15,000 in ACA subsidies. ACA premiums will rise next year because of underlying flaws in the program. Only a small portion of the increase is from the expiring COVID credits. The underlying ACA subsidies provide enormous protection for more than 93% of enrollees from high premiums. Most will pay less than $80 a month for a plan next year, with the federal taxpayer picking up 80% of the premium cost and a higher percentage for lower-income enrollees. The Inflation Reduction Act set the COVID credits to expire after 2025, and they should end. Continuing them would exacerbate fraud, increase premiums and healthcare prices, drive out alternative financing arrangements, remove the imperative to reform this failing program, and drive the country deeper in debt. Real reform does not mean spending more taxpayer money. It means giving consumers the freedom to choose the coverage and care that best meets their needs. Thank you.
Thank you, Dr. Blaze. Our final witness is Ms. Shauna Verstegen. Ms. Verstegen is the fitness director at Supreme Health and Fitness, a small gym located in Madison, Wisconsin. She and her family receive health coverage through the ACA Marketplace. She received a degree in kinesiology.
You got this.
I actually tried to
Kinesiology.
figure it out, but I'll let you say it. Exercise science from the University of Wisconsin. Ms. Verstegen.
Good afternoon, and thank you so much, Senators, for the opportunity to share my family's story here today. My name is Shauna Verstegen, and I live in Madison, Wisconsin with my husband and our 2 wonderful little boys who are 7 and 10 years old. I'm a proud member of Moms Rising. I'm here today as a proud user of the Affordable Care Act and the healthcare marketplace. Like so many other working families, I don't know what my family would do without it. My husband and I both work in the fitness industry as trainers and group fitness instructors at a really wonderful small gym in Madison. We love our jobs, and we both work very hard helping others on a daily basis. We've both been employed there since high school, so almost 30 years. Due to the small number of full-time employees at our gym, the owners don't provide us with health insurance. So we purchased health coverage for our family through the ACA Marketplace for many years. We currently are paying $460 each month for our family of 4. Without the enhanced premium tax credits, our premiums are projected to increase to an unaffordable $700 a month in 2026. Losing enhanced premium tax credit support would create a real crisis for my family. Trust me, we've already cut back on spending in every way we know, along with adding lots of additional work hours to both of our schedules. We rarely go out to eat. We haven't gone on a vacation in years. And for 2026, we're looking at scaling back some of our children's sports and other activities our kids enjoy. With the threat of the subsidy ending, we're exploring all of our options. My husband is even considering finding another job that offers employer-sponsored health coverage. That's been really emotional for us because although we're certainly not above working at a large realtor like Costco, it would mean setting aside the skills he went to college for and work that we truly love. We're also considering shopping for a cheaper plan, most likely with a higher deductible, but that's risky for our financial stability. We also did talk about not being covered at all, but with 2 kids, that didn't sound like a safe choice for our family. These options and decisions are tough and, quite frankly, really scary. We're a middle-class, healthy, hardworking family, and like so many others, we're struggling to make ends meet with the prices for food, housing, clothing, electricity, and everything else skyrocketing. The prospect of our health insurance premiums increasing by several $100s is devastating for us. It would be a major financial blow to my family. This truly doesn't feel like it's about politics or polling or winners or losers in Congress. Families like mine in every state, red states, blue states, everywhere in between, rely on the Affordable Care Act. This is about real families, real kids, and real health. Speaking of health, I grew up with a mother who had Huntington's disease, a devastating genetic neurological brain disorder. Living at risk of inheriting it myself, I spent years fearing that I would never be able to obtain health insurance. Although I ultimately tested negative for the disease, the Affordable Care Act gives me a peace of mind that I will be covered no matter what health challenge I or my family may face. Sadly, many in the Huntington's disease community who've become like family to me did not receive that same test result. At our state chapter convention last weekend in the Wisconsin Dells, there was so much to celebrate. Just over a month ago, new research identified a potential treatment, a really big moment of hope for our community. But that hope was shadowed by fear. Many families expressed deep concern that the Affordable Care Act may be overturned and they may lose the access to the essential health care that they depend on. None of these individuals did anything to deserve the genetics they were dealt, and they too deserve affordable, reliable health care, just like every one of us. The Affordable Care Act is essential for entrepreneurs and small business employees like myself to afford health care coverage. The Affordable Care Act is essential for those with pre-existing conditions like Huntington's disease to afford health care coverage. The Affordable Care Act enhanced premium tax credits are essential for millions of Americans to be able to afford health care coverage. I am here as an example of the people who you all represent. I'm a working middle-class mom speaking for 24 million other Americans who rely on the Affordable Care Act to keep their children healthy, their bills manageable, and their futures secure. I ask you sincerely and urgently to stand with us and support the families who need you now more than ever.
Thank you, Ms. Verstegen. I'll start with questioning. You know, I purchased health care in Wisconsin for my smaller business for about 30 years. And just quite a few years before we even got over 100 employees. So I'm very familiar with the small employer market. We actually had, for 1 year, when one of the companies was really trying to buy share, where we had $0 deductibles. I mean, literally, everything was covered. There was no deductibles, there was nothing. I think next year they raised premiums 40%. We had to, switch over. But we were talking about $100 deductible per person with out-of-pocket maximum of a couple thousand. I think when I left in 2010, the most I ever remember was a couple deductibles, $2,500 per person with an out-of-pocket maximum about $5,000. Again, it's off the top of my head, but again, nothing like you're describing right now. So I would like to, and again, appreciate you working with our staff trying to fill in the details here, but I'd just like to kind of get a feel for, what your current situation is and kind of where you've been in terms of healthcare. So going back to 2013, I'm showing you the rate of increase since the implementation of Obamacare. What kind of insurance did you have in 2013?
Yeah, in 2013, our gym was a bit larger. It's a racquetball gym, so I don't know if any of you play racquetball. You probably don't know many who do. Therefore, it has gotten to be much smaller. And back in 2013, we did have employee-sponsored healthcare at that time.
Okay, so you had employer sponsor?
Yeah.
Did you contribute anything to it?
I did, and it was actually really.
I don't expect you to remember. Do you remember approximately?
No, I sure can, and I remember this because
Okay.
my husband and I weren't married yet. And because I was a female of childbearing age, I paid almost $600 a month.
Okay.
And he had to pay under $200 a month, and we found that really unfair. So it was actually, even though it was employee-sponsored, still quite unaffordable.
So then 2014, 2015, you're also on employer-sponsored care, correct? Is it
Yes.
was the same one, similar
Yes.
types of rates?
Yes,
Again, you were paying about $600 a month.
yes. I can't give you, I apologize, I don't have the exact numbers on me.
So in 2016, your employer no longer covered employees, so you end up having to get your insurance through the Obamacare exchanges. Next thing I have is in 2019, you were paying $1,000 a month for a silver plan.
In 2019, I don't know if it was a silver plan. I know it was a higher tier plan that we have
That's what you told us
right now.
when you were looking.
Yes. So
Okay.
I chose a higher plan, and it was about $1,000 a month.
Do you remember what the deductible was? And by the way, do you have deductibles and then an out-of-pocket maximum? Is that how that works on your
Yeah,
exchange?
this year I don't have deductibles. I have fairly high copays and an out-of-pocket maximum. I do not remember what my deductibles were in that year that I was paying about $1,000, but I
Okay.
know they were significantly less than they are now. We have a lower tiered plan now.
Because now you say you switched to a bronze plan,
Mm-hmm.
and that was $250 a month. But you said I'm assuming you're assuming it's out-of-pocket maximum of $14,000? Or is that just a deductible of $14,000?
The 14,000, I believe, is an out-of-pocket maximum. It's not $250 a month. It's $460 a month.
No, in 2021.
2021.
That is $250 a
Okay,
month.
yeah.
So now.
Yes, when we dropped to that lower tiered plan, yes.
And you were getting subsidies back then?
I don't believe so.
Back in 2021, you weren't qualifying for subsidies?
I can't recall.
Okay, I would think paying $250 a month, you probably were. Can we put up this next chart? And I've got this sheet in front of you. I've tried to cobble together what I think is representative of the kind of plan you're on. I'm not saying that this is yours, but this would be somewhat similar. This is a bronze plan. So for 2025, you're saying that your net premium is $460. And I know in your house testimony, you said you had a subsidy of $800. So your gross premium was $1,260 a month. So on an annualized basis, that's $15,000 gross premium. You got a $9,600 subsidy, and you paid $5,500 bucks. Okay. Now, in Wisconsin, we're not the national average 26% increase this year. We just read this about 17%, but I did this based on 26. So assuming the national average gross premium increase, your total annual premium is going to go from $15,000 to about $19,000. Is that about what you're seeing in your? It's probably a little less than that because what I heard in
Little less.
Wisconsin, our average is about
A
17.
little less than that, yeah.
Okay, but somewhere around $18,000, $19,000.
Yeah.
You're saying you're going to now be paying $700 a month. So that translates to $8,400 annually, correct?
Yes.
Times 12.
Yes.
So that means you'll be getting a subsidy still of about $10,600, roughly, about $10,000 subsidy.
No, my subsidy is
If your premium's
$420.
$18,000, $19,000, you're paying $8,400, you're going to get about a $10,000 subsidy, even with the enhanced subsidies going away, the temporary subsidies, when they
Yeah,
expire.
the enhanced was much more than that. Right now, it would go down to 400.
Okay, the last column is, what I did is I deflated the 19,000 back to 2013. And that gives us about $8,500 is what your premium, a similar type of plan's premium would have been before the ACA. Then if I reinflate it based on employer-sponsored insurance going up about 64%, your premium should be no more than, should be less than $14,000. That's a $5,000 difference. Now, if you inflate it just based on inflation, 39%, you'd be saving about $7,500 in premiums. So again, I'm just laying this out. This is what's happening. So there's no reason for a plan like yours to cost $19,000 a year. But even with the temporary subsidies that, again, we're not the ones that set those to expire. That's what the Democrats did. Even with those subsidies expiring, again, you'll still be getting $10,000 to $11,000 subsidy. The problem is the premium, the gross premium, and that is being, we'll talk about this later with our other witnesses, that's Obamacare's faulty design. The fact that it forced all of the individuals like you in these individual policies to bear the full cost of covering people with pre-existing conditions. Prior to Obamacare in Wisconsin, we had something called a high-risk pool. It worked great. Now, it wasn't perfect. You could have tweaked it to make sure that everybody with pre-existing conditions were covered, but Obamacare did away with those and put that full cost of covering people, pre-existing conditions, on the backs of people like you. That's why healthcare primarily is so expensive on the individual exchange. There's many other reasons, but we'll get that into witnesses.
Is this can I answer?
Sure.
I know it wasn't exactly a question, but again, I'm not here to speak on, I'm clearly not an expert on why the co-pays and why the premiums and everything are rising. But I do know that the Affordable Care Act is the only option for coverage for my family. It's the only option for coverage for Huntington's disease families, for entrepreneurs. And I would really hope that lawmakers would work together to help rein in this corporate spending to help bring that down. And quite honestly, yes, the premiums are going up, but so is my gas, so is my electricity, so are my grocery prices. And I don't feel like the answer to this is to increase our premiums more. I know you said this is Democrat sponsored, but Republicans and everybody have the power to pass this extended premium tax credit so our bills don't go up even more. I'm not here to fix this today, but please help us for 2026.
The reason this is your only option is because Obamacare made it your only option. The reason you can't afford it is because Obamacare made premiums skyrocket. So again, it doesn't make any sense to throw hundreds of billions of dollars to hide and mask the faulty design of Obamacare. I am happy. I would be more than willing to sit down in good faith to work with Democrats to repair the damage done by Obamacare and transition to a system that actually keeps costs down. But again, when you've gone from an insurance policy that was probably about somewhere around $8,000 before Obamacare to now it's $19,000, four times more the rate of inflation. Yeah, everything's up, but everything's up 39%. Obamacare rates are up, what did I say, 169%? I forgot the exact figure. Again, it's the faulty design. With that, I'll turn it over
Respectfully, Senator, if I had tested positive for Huntington's disease, what would my option have been then?
Again,
I wouldn't have had an option.
So what we would have done is high-risk pools. We would have had guaranteed issue within those. The cost would have been spread over everybody. That's the way it was originally.
My friends who tested positive were not able to afford
had a
in a
small
plan.
percentage onto their insurance, and it paid for the high-risk pools. It worked marvelously, but Obamacare outlawed that. But anyways, Senator Blumenthal.
Shauna, let me begin by very sincerely thanking you for being here today, because it takes a lot of courage to talk about your personal story, about your mom having Huntington's disease, about the sacrifices that would be made by your own family if these healthcare tax credits are not extended, about the real-life impacts on you. It takes bravery to do it. And so I'm going to explore a little bit more about that story and about the powerful way that you've articulated what it means to have, in your words, peace of mind, knowing that your mom had Huntington's disease and that it is a genetic disorder. And I have to tell you, I am struck by your description of the meeting recently of your Huntington's disease community, your state chapter. when you heard about a new treatment that might be available. Very exciting for people, and I'm quoting you, none of these individuals did anything to deserve the genetics they were dealt, and they deserve affordable, reliable health care just like every one of us. That new treatment will be available to them only if they have health insurance, correct?
I assume so.
And they're your friends, your neighbors, and your own family, because we all know that your two beautiful children inherit the genetic makeup of your family. So I wonder if you could talk a little bit more about how you're affected in the way you look at your kids when they go to bed at night, the way you see your family, the way you and your husband think about your lives, and the possibility that you may not be able to afford health insurance.
Yeah, well, it's caused some very serious conversations in our household the past several months since we've known the possibility of not having this extended premium tax credit, and already working really, really hard to make ends meet. We are having these conversations about what else we can cut out. For a while, the conversation included, do we just go without health insurance? But that's too big of a risk that we don't feel comfortable doing. And right now, we're leaning toward my husband leaving the small business that we love so that we can have affordable health care.
And the treatment that's potentially available to people who suffer from Huntington's disease will be available only if they have that health insurance.
Well, unfortunately, that's still probably a few years in the works before that's available. But yes, it will require health insurance to be able to afford that. It'll be a pricey treatment.
Any new medical or
Yes,
scientific
of course.
advance.
But anybody with Huntington's or living positively with Huntington's relies very much so on health care. And even somebody who is tested positive who might be very healthy for a long time, before the Affordable Care Act, they were not able to get coverage because of the knowledge that they will become sick someday.
Now, that new treatment could well be expensive.
It will be very expensive.
Sometimes advances in medical care are expensive, especially if they are newly developed and they haven't been mass produced, like pharmaceutical drugs become less expensive the more generics are available, correct? I hope that we will take action to lower the costs of health care. And I've actually strongly supported those kinds of efforts. I've consistently called on insurers to reduce their rates and on providers and drug manufacturers to reduce the costs of their services or products. I've also led investigations into abuses by insurers participating in the Medicare Advantage program. I'm hoping the chairman will join this effort. One thing that will reduce costs is giving Medicare more power to negotiate lower drug prices. I'm hoping the chairman will join me in that effort as well, and others on this committee. And I believe strongly that we can help eliminate fraud in this system by taking action against the insurers, brokers, and navigators who are exploiting the weaknesses in this system for self-gain. And that's why I have sponsored measures to take action, particularly enforcement action, against them. One is the Insurance Affordability, the Insurance Fraud Accountability Act, which would impose criminal penalties on brokers who engage in deceptive marketing or enrollment practices. I'm hoping maybe the chairman will join me and other Republicans as well. These are specific steps we can take to stop fraud. We should have zero tolerance for fraud, no matter whether it's in the billions or the pennies. I hope all the witnesses will agree with me on that point. But it doesn't mean throwing the baby out with the bathwater, as the saying goes. It means focusing, targeting, and using new laws as well as existing enforcement authority and giving them the resources that they need to go after fraud. So I'm hoping that we will have a second round of questions, Mr. Chairman, when we can explore some more of these issues. I have additional questions. And for right now, I'm going to abide by the time limit because my time has expired.
Senator Scott.
I want to thank the chairman for putting this together. Back in '29, I organized a group called Conservatives for Patients' Rights to try to figure out how, if we're going to pass healthcare reform, let's do it in a manner that drives down the cost of healthcare. Because I think all of us want to make sure people not just get healthcare insurance, but they actually get healthcare. Healthcare means that you can afford to go to a doctor. Healthcare means that you're not bankrupt if you have a catastrophic illness. And unfortunately, what passed didn't make any sense. As we know, when Obama promised you wouldn't lose your doctor, what happened with that? Biggest lie of the year. He promised you wouldn't lose your plan. No, you lost your plan. Then they set it up to where there was an increased incentive to take care of able-bodied adults rather than, in my state of Florida, you got paid, the state got paid more money to take care of able-bodied adults than people on disability. I mean, that actually made no sense at all. Then what's happened is exactly what we thought. When I became governor, so I was running different companies at the time. I bet the deductible was, I can't imagine it was more than $1,500. A catastrophic plan was $3,000 or it couldn't even be $5,000. And now what you look at is deductibles have skyrocketed, premiums have skyrocketed, co-payments have skyrocketed, and basically what was a catastrophic plan back then is the normal plan now. So it doesn't make any sense. And then to mask the cost of these premium increases, which the premiums are going up. Why are the premiums going up? Well, hospitals are charging more money. Drugs are charging more money. All the players in it are charging more money, and then there's nobody there that says, oh, do I really need to spend that money? Like all of us have children, know that our children spend the money they make way more efficiently than this money that we give them. And so it just seems to me, if we actually want to fix this, there's really only two things that really are going to fix it. One, we've got to make every American a consumer of healthcare. That means when you go buy something, you look at the price, you look at the quality, you look at the service, you question it. That's what we should be doing in healthcare. But people don't have actually the opportunity to do it because they're dictated by either the government or they're dictated by their employer of what they have to buy. They don't have choices. They don't have a choice of a whole bunch of different plans they get to do. Then on top of that, let us, we need to make sure anybody that needs health care, they've got to have access to a plan that they can afford. And before Obamacare, I think it was 40-some states had high-risk pools that really took care of the people that had chronic problems that were significantly higher than what the normal person would have. Unfortunately, Obamacare stopped all that. So the only way we're going to get this fixed is, number one, we've got to make everybody a consumer. So if we're going to get, my belief is I did it when I was a consumer. I let my employees choose their health care, choose their plan. I didn't say, oh, you have to buy this plan. They had co-payments, they had deductibles, so they had incentives to be healthy. So we need to be able to do that with regard to any government-sponsored program. And then there has to be unbelievable choice. So one person might be worried because of family history of something. Another person is not worried about that, so they don't want to do it. So we got to figure this out. So So now we've got these Biden COVID era subsidies. It's unbelievable fraud. The money's going directly to insurance companies. How does that make any sense? It goes just check directly to the insurance companies. We know millions of people have been getting, supposedly been covered. They don't even know it. They don't even know it. I mean, the money just went to an insurance company, right? Nobody knew it. And so I'm glad the ranking member wants to crack down this fraud. Why didn't they do it when they passed this? I mean, there's unbelievable fraud allowed. I think all you had to know is somebody's name, address, and birth date, and you could sign them up. And then people were doing it all the time. And then we have people that are worth $1 million, and we're subsidizing their health care. Now, most Americans are not worth $1 million. So we have people that are busting their butt, working every day, 40, 50 hours a week, and we're subsidizing health care of millionaires. That's wrong. And that's exactly what these Biden COVID era subsidies did. So I want to make sure people get health care. I want to make sure that if you have a chronic illness, you have a plan to get it. But this idea that no accountability, insurance companies make all the money, and no accountability, and for rich people, it makes no sense to me. So, Mr. White, my staff looked at some of the plans available in Madison, Wisconsin on the individual exchange. The premiums are too high, right? And deductibles are too high. And so often, I mean, you can get insurance, but you don't get health care, right? So how's that as compared, what you would get through these COVID era plans, or the Obamacare plans covered, the mass cost by the COVID era plans, how's that as compared to employer small group plans? What's happened to the cost?
The tragedy, I think you put your finger on it, is that for consumers, you can only use your subsidy on Obamacare. And those plans in general have 3 times higher deductibles than the average Obamacare plan. So the average Obamacare plan, the silver level unsubsidized deductible, is $5,000 a year, thereabouts. The average small group plan is about $2,000.
And you can't do it.
You cannot use
Why?
your subsidy.
Why would they do that?
That's how the law is written.
But why would they do it? Why would that make any sense? Why wouldn't you have an option?
Why wouldn't you have an option?
Yeah.
I don't know. The authors of the law designed it this way, and what we saw pre-Obamacare, about 50% of small businesses offered coverage. Post-Obamacare today, just 31% do. So 12 million people have gone from small business coverage, and they're now getting Obamacare, which means
Small business with options.
they're just, the small
had
businesses
options when they
dropped
were-
coverage,
Yeah.
and they sent their employees onto the exchange, where they're paying 3 times higher deductibles, higher premiums, including unsubsidized premiums, and they're getting worse access to care. 80% of the plans on Obamacare right now are exclusive HMO type plans or exclusive provider arrangement plans, which means if I tried to go out of network to a doctor, the insurer would pay $0. That is significantly impeding my access to care. We have to keep in mind, coverage does not equal care. Just because I have an insurance card doesn't mean I can see a doctor. And what we're seeing in Obamacare right now, compared to the employer market, is I can't see my doctor. I can't afford the deductible, and the doctor's not in my network. If I just stayed with my small business, we created incentives for small business to retain employees, we would have far lower deductibles, far lower premiums, far greater access to doctors, and taxpayers would spend 3 times less.
Thank you.
So let's break this down to the fundamental components. To answer your question, the purpose of Obamacare, because he knew it wouldn't hold on costs. I mean, this was predictable. I'm sitting there in Oshkosh. I mean, that's why I ran for office. I knew this would be a miserable failure, right? The reason Democrats passed Obamacare is because they wanted it as the next step to a single-payer system, which is why they had the federal government pay $9 for every dollar the state spent on a single able-bodied, working-age, capable adult, right? Which has led to all kinds of massive fraud. And quite honestly, really caused states to structure their budgets around it, hospitals to structure their budgets around it. So when we try and reform it, like Senator Scott was going to do, let's just cap it. If you want to, as a state, cover single able-bodied, fine, but not a 9-to-1 match. Do like you do a disabled child. $1.33. So again, the fundamental of Obamacare was, this is our way to get to a single-payer system. But let's talk about the fundamental flaws, why it didn't lower costs. Consolidation of industry. It led to that, which, by the way, the cost of employer-sponsored plans is a lot lower than the exchanges, but it's
Y'all understand why the cost went up the way it did, right? Y'all understand that because the Republicans took the individual mandate out. The costs, only people that get Obamacare are people that were high risk, were people who couldn't get insurance otherwise, were people who were necessarily poor. You have to have an individual mandate. You have to have the mandate in order to keep the costs low for every person. But the Republicans repealed it and took it away from the ACA when they were in charge the last time. That's why the prices have skyrocketed in Obamacare.
It's still way too high, and I've got to think that the flawed part of the consolidation contributes. So there's no reason for insured plans to be almost double the rate of inflation. So is that so?
They're not going to say that. They're not going to say that.
Consolidation of the industry as succinctly as you can.
Republicans gonna say
one of
that.
the fundamental flaws of Obamacare.
Yeah, I think to answer your question, there were the law creates this one-way street into government-run healthcare. That's absolutely true. Once the small businesses drop their coverage, they generally don't come back, which is a huge problem. In the consolidation space, though, what we saw was, again, massive consolidation in the insurance markets and massive consolidation in hospital markets. That hospital market consolidation drove up prices by 15 to 30%. That flows directly through to
And
premium.
again, that's just basic economics. When you have less competition, people kind of look around and go, oh, we can charge that, we get away with it. And also the medical loss ratio, there's no incentive to reduce costs anywhere along the supply chain, right? There's absolutely no incentive to reduce costs.
It's worse than that.
It's all to increase costs.
The medical loss ratio actually encourages higher premiums, as Dr. Blaze indicated. It also creates incentives for insurers to buy practices, which they've done, and pharmacies and PBMs, which further consolidates the market because they can drive revenue through those entities that then allows them to avoid the cap on profits. So it further consolidates the market and drives up costs across those markets. All those costs bleed over into the employer market. I think what you see in the difference between the 168% increase in Obamacare and the 78% increase in employer markets is the employers are not subject, the large employers are not subject to all the mandates and regulations and requirements that the authors of the law put on the individual market, making it much more expensive. Those costs are built in, they're structural, they will stay there. It doesn't matter how much you subsidize them, the costs will just keep going up and
Again, the
up and
full
up.
burden of guaranteed issues on the individual markets as well, right? Mr. Bragdon, talk about the lack of access to disabled children because they're being crowded out by single able-bodied working age childless adults. I mean, talk about that outrage because that's not discussed enough.
I think one of the most perverse parts of Medicaid expansion in Obamacare is when Obamacare loaded the lifeboats, it said non-working men first. And then pregnant women, the elderly, disabled, kids with disabilities later. And it creates this incredibly perverse system, as you talked about, that contorts all sorts of money laundering schemes by states to maximize the expansion population, but it also then incentivizes that kids with disabilities or adults with disabilities are on the chopping block first. Because when states need to save money, they save more by cutting services to those individuals.
Is it also true that, Biden allowed providers to charge commercial rates for the Medicaid expansion population?
Correct, so you had this dynamic.
So I mean, just the providers themselves get reimbursed more for an adult, healthy adult versus a disabled child, correct? So what do you think providers are going to do?
Correct. They're going to respond to financial incentives. And so if I make more money by serving a Medicaid patient of an able-bodied adult than I would an elderly person or disabled person on Medicare, of course, they're going to be prioritized.
Dr. Blaze, talk a little bit about the impact of putting all the guaranteed issue cost burden on the exchanges, basically, correct?
Yeah, I mean, it's.
Because before individual, they had the high-risk pools. And as an employer, that worked beautifully. When we would have something they'd called lasered out of our plan, somebody had cancer or something, they would go into high-risk pool, exact same coverage. I mean, same deductible, all that type of thing, same rates. It worked great. And then when they got well, they'd come back onto our plan. But go ahead.
Yeah, so there are 35 states that had high-risk pools, and that's, if the person couldn't get private health insurance, they would apply to the state high-risk pool, and they would get coverage through the high-risk pool, and that was subsidized. The critique of high-risk pools was they weren't adequately funded. What we could have done instead of the gigantic Obamacare regulatory and subsidy structure, which inflated premiums for everyone, is just provide more funding for state high-risk pools. But we
What tampon, Grand DA, Grand Garden? What tampon?
chose a different
I
approach.
think they were funded well in Wisconsin. And anyway, that's really got to be the first step. You know, we talk about free market reforms. We have to do that as the way to make sure that people with pre-existing conditions get coverage. I mean, we've got to tweak those high-risk pools, but we have to first reinstitute them, correct?
Yeah.
That's kind of like, that's sort of the first step.
The reason why Obamacare went down the road that it's going is because the Republicans in 2017 repealed Obamacare and then took away the individual mandate. And the individual mandate was what kept the prices lower because regular people could get insurance. Like I said, now people who have the Obamacare are the people who were paying like thousands of dollars for the insurance. So now their insurance is about to go back up to where it was before the individual mandate was in place. So now it's really going to go back up. This is all the Republicans' fault.
Things we have to do.
Yeah, I think.
Which, again, when you dismantle something, it's kind of a pain to have to reestablish it. But
It was not found against the law. Blood fart. Look it up.
that's what we have to do.
Yeah, I think if you're
just
going to
saying
revisit Obamacare's architecture and really lower premiums, then reinstating high-risk pools.
That's the only way for all of us to have cheaper insurance is if everybody had the insurance. That was the only way to make sure that people who had pre-existing conditions could get it without it skyrocketing. Now it's about to skyrocket where it was before they put the individual mandate on it.
And having them funded is a reasonable
Well,
action.
if you don't revisit Obamacare's architecture, you're not going to bring down costs.
No, Obamacare inflated costs significantly in the individual market. And one of these, the medical loss ratio, I mean, one of the things that we've seen, because we have all of these phantom enrollees, and so insurers have made a lot of money on phantom enrollees, but the minimum loss ratio means that they need to spend that premium revenue. So they have very bad incentives to look the other way on extremely high costs on the other end. So you're getting very inflated costs for high utilizers that benefit providers and big hospital systems. And there's a lot of sort of corrupt behavioral health and addiction treatment services that are taking advantage of that system.
That you have to explain.
I'm just giving you
I
the
sort of
facts,
understand,
man.
but that's.
I'm just giving you the facts.
Senator Ernst, are you ready to go?
And you weren't taking care of every
all of
other.
our witnesses
You were the
for
one that.
being here today. And this is a really important topic, and I do hope that we can get this government shutdown over and open back up so we can have follow-on conversations regarding this topic. I visit with Iowa farmers every year, what I call my Iowa River to River tour. And I hear way too often about the crushing weight of healthcare costs on farm families. And it's really disheartening to me to hear that, but it's not at all surprising. The Unaffordable Care Act's one-size-fits-none model ignored the realities of self-employment, seasonal cash flow, and the absence of large corporate employers across our farm country. So our spouses, when it comes to
Yes, there need to be some action. They need to figure out how to fix well, you gotta give the individual mandate back. Figure out how to get the individual mandate back, and then it'll be cheaper. But the Republicans fooled around with it and took the individual mandate away, and that they were chipping away at it, and that's what they wanted to get rid of it, so they chipped away at it. They don't want to give nobody fucking insurance. They just want you to be out there going to the emergency room.
The farm families, oftentimes they're serving as the family farm's bookkeeper, maybe a mechanic, they're a veterinarian, they're helping with all of the farm activities, all rolled into one. Many of them have been forced into taking
Blood fart. Why you don't do research? Why you keep running your mouth about something being against the Constitution? They never would have been able to put it into place if it was against the Constitution. Why y'all just be talking? Don't be doing no research. Just be talking.
off-farm jobs, not for passion, and I love that people are able to pursue their passions, but, in farm country, we do what we need to do to make sure ends meet. And so we have a number of those spouses that have gone to get employment where they have employer-sponsored coverage. That means 40 to 60 hours a week away from the very enterprise they're trying to preserve for the next generation. And this isn't a one-off anecdote, it's reality for far too many Americans, including my own family. I'm in a farm family. My brother is a type 1 diabetic. He had to leave the family farm operation to take employer-sponsored healthcare coverage with his employer. My sister is a type 1 diabetic. She and her husband do our family farming, but she also works a full-time job off the farm to get employer-covered healthcare. Okay, so we do have to make very tough choices. But unfortunately, Obamacare is unaffordable. And because of this horrible system that is out there, some families are not able to choose to do what they want to do, and they've been driven into other opportunities. But Democrats in Congress have branded Obamacare as a chance to bend the cost curve downward, and that's not true. As it turns out, the only thing it's bending is the bottom lines of every farmer, whether they're in Sioux Center or over to Keokuk in Iowa. And the numbers don't lie. Farmers and their families are subsidizing a broken system that doesn't serve them. Rural America needs solutions that don't force spouses to find off-farm work or forego health insurance altogether. Premiums for both plans on and off the exchanges are going up for individuals and small groups.
Why they don't? My question is why they don't fix Obamacare? Why they won't fix it so everybody can have health insurance? So they wouldn't have her brothers and sisters wouldn't have to quit their farm job to work at a real job to get medical insurance. Why they don't want to fix it? Republicans don't want to fix it. They just want people to get off of insurance and make somebody else pay or let them pay or who dies or whatever. They don't care one way or the other. The whole point is to fix the system.
In large part due to the Unaffordable Care Act's many mandates. This is particularly challenging for self-employed folks and small businesses. So, Mr. Blaze, if the ACA was supposed to expand choice and lower costs, why are so many counties in Iowa down to just one insurer on the exchange?
Because they wouldn't insure all the sick people without having some healthy people on there. Now they're down to people who gotta have the insurance. When you had the individual mandate, everybody could join, sick or well, and have decent coverage. Wouldn't cost that much money. Now they can't do it. So now it's going to skyrocket. Oops.
And why are premiums still unaffordable, even with taxpayer-funded subsidies?
Well, Senator, thank you for that question. And some states like Iowa have taken steps to address problems with Obamacare by opening up like Farm Bureau plans and enabling more people to purchase that coverage.
What was that system, Mike? What was the name of that system? Name it. What was the name of that system? What was the name of the system that you had before we had Obamacare? Mike, put it in the chat. We would love to hear it. I know what you're talking about too. What was it?
That's not subject to Obamacare.
If you're going to be fucking honest, be fucking honest. What was the name of the insurance that people had before Obamacare came along?
Rules. But the answer to your question is that Obamacare failed. It reduced choices and options for individuals.
Exactly. One insurer. One on most of our exchanges. Mr. White, do you think that having coverage for many farmers in Iowa?
Ding, ding, ding. Mike is right. The food stamp, the public aid office would give you the Medicaid and the medical and the Medicaid and the Medicare. That's what we currently still have is Medicaid and Medicare. The same thing we still have. So should we just scrap Obamacare and then put everybody on the Medicare, Mike? The Medicaid? We can go back to doing that. That's a single payer. Hey, more people would be more than happy to go back to that system.
Iowa means that they have access to care.
That's what it was. You said it. You the one said it. The government system was called Medicaid and Medicare. That was what people had before Obamacare came along. Damn, y'all don't know nothing. Shit.
I think getting an insurance card in your wallet doesn't mean that you have access to a doctor or a drug on the plan's formulary. What we're seeing increasingly is these plans are HMOs or exclusive provider organizations, 80% of them on the exchanges. That means if you
People who work can't get Medicaid if they make a certain amount of money and the employer don't offer insurance. That's why they invented Obamacare, dingbat. So people like you would have to get Obamacare. So why can't you get Obamacare, Mike? Because it's too expensive? Is that why you don't have Obamacare?
go try and go out of network or get something off formulary, the plan pays $0. That's not access to care. We're paying, like, the premiums now are so high, the deductibles are so high that families are struggling just to meet those obligations.
The Republicans did not want to expand Medicaid and Medicare for regular people. They would not let them expand it. That's why people can't get Medicaid or Medicare who work. I mean, ones who make a certain amount of money can't get it. That's why you ass out. You ass out for Medicaid and Medicare because Republicans didn't want to extend it to people who make X, Y, and Z. And then they took away the individual mandate from Obamacare, which really burnt up the rest of the people that was on Obamacare. Jesus.
Obligations, but then they're being massively constrained to the point where they're finding difficulties just going to a doctor or finding a doctor in their area to help them. This is not good coverage. This is really inferior coverage compared to what we see in Farm Bureau plans, in small businesses, and large businesses.
Right, and as the chair had stated earlier, so many of those plans, the high-risk pools, they were all outlawed by Obamacare. I'm also concerned about Iowans being signed up for policies without their knowledge. This is a really big deal. It should be a big deal for every single American that is paying taxes out there. Mr. Blais, I believe you spoke to that. $0 premium plans have enabled those scammers to take advantage, and look no further than enrollment for individual plans in Iowa doubling or quadrupling depending on the plan type since 2019. So, Mr. Blais, 9 out of 10 healthcare dollars flow through third-party payers. Do you think this has a role in the levels of fraud and waste that we see in Obamacare today?
I can't make y'all educate yourself. Stop saying dumb shit, Black America. There's certain people who can't get medical insurance. Just like there's some people who can't get food stamps. Why is that so hard for y'all to understand? I don't understand why. I don't understand this mental deficit. I just don't understand it. What's going on?
Yes, Senator, thank you for that question. The Biden-era COVID expansion of the subsidies led to massive increase in fraud in the program. The availability of fully subsidized plans allowed bad actors, brokers, agents to advertise things like free gift cards, cash, to get people's information to sign them up for plans. Bloomberg did a report on this. They quoted a customer service agent who said half of the people that they were signing up had no idea that they were enrolling in coverage. And the big winners are the health insurance companies. So they're getting monthly checks on behalf of all these enrollees that have no idea that they're signed up for coverage.
Right, thank you. And I do think this is a real issue, and I do hope we can reopen the federal government. I hope Democrats come along with us and vote yes to open the federal government so that we can have further discussions. But I must say to all of my Democratic colleagues, we need to have a robust discussion.
You a lie, Mike, and the truth ain't in your ass. What the hell costs $30 or $40 a month? What costed $30 or $40 a month, Mike? I would love to know. Not that they won't, not that I don't believe you that the cost is much. I'm saying, what insurance? You had insurance previously, didn't you? So apparently you knew it cost $30. So Medicaid and Medicare was charging you money? You said you couldn't get no damn insurance. Medicaid and Medicare is charging you $30 and $40 a month? Some of y'all just be talking. Just be talking.
Discussion about what is wrong with Obamacare. If we truly want to find accessible ways to provide health care to individuals, affordable choices, then we need to identify all of the failures within this system. So then maybe more people can pursue their dreams. But when it comes down to personal responsibility, my family members have had to make that hard choice to seek employer coverage. It is a personal choice to take care of their own families. And I think personal choices then shouldn't be the obligation of the federal government to find ways to fund access to health care. We all need to figure this out. But again, I really appreciate the opportunity to have this hearing today. And I hope that, again, we can open the federal government and have real discussions about these very real problems for Americans as they're trying to access health care.
Senator Hassan.
Well, thank you, Mr. Chair and Ranking Member Blumenthal. Good afternoon to our witnesses. Thank you so much for being here. I just want to follow up a little bit on what Senator Ernst was just saying, because, of course, Democrats and Republicans want to lower the cost of health care. There is bill after bill filed on a bipartisan basis in this chamber that would do that, including approaches to some changes in the Affordable Care Act. I remember, of course, when the Affordable Care Act was passed, when so many of my constituents in New Hampshire with pre-existing conditions could not get health insurance, full stop, impossible to get, where people were making the same kind of choices that Senator Ernst
Y'all read what I put in the chat.
just talked about,
Read what I put in the chat, please.
because they couldn't get individual insurance under any circumstances, so they went and took a full-time job or didn't move to a new opportunity because they would have had to wait for a year to get health insurance in that new job. I remember as governor the difference the Affordable Care Act made and has made with Medicaid expansion, when people who were chronically ill and couldn't work and therefore couldn't have insurance got insurance through Medicaid expansion, got their diabetes under control, went back to work, and went on to private insurance. That is exactly what the Affordable Care Act has done for tens of thousands of people in my state. And as I hear my colleagues talk, we do need to reopen the government, and we need to take care of a mounting crisis for which we have a very small window to solve, because there are insurance premium bills hitting my.
The Republicans are having these hearings so they can let the American people know that, oh, Obamacare is failing. They're fighting for higher premium. They're fighting for X, Y, and Z. Instead of saying, let's fix Obamacare, you will not hear one Republican say anything about fixing Obamacare. Not one, because they want it to die. They don't want nobody to have insurance. Nobody.
Constituents' web pages or mailboxes
Blood farts, you're dumb and you're a zombie.
that show them directly that premiums are skyrocketing in New Hampshire right now, both on the Affordable Care Act and on the private market. Open enrollment on healthcare.gov began on November 1st, and I've heard directly from Granite Staters who, when they logged on, saw that their premiums have doubled or tripled for next year. These premium increases are being driven by the Republicans' refusal to extend the enhanced tax credits that help Granite Staters afford their health care. This week, I met Nicole, a mom of 4 in Exeter, who is a full-time caregiver.
Blood fart. It's the Republicans that have all of those insurance and Medicaid and Medicare. They are the ones that have the most use of it. Man, some of y'all just be talking, don't even know. What the hell you talking about? The Democrats want free shit. Everybody pays into the system. You ain't the only one. Republicans ain't the only ones that pay into the system. Y'all need to get some more talking points. I told you, when they don't have no answer, they don't have no answer. You don't have no answer. Just like these people in this meeting right now don't have no answer for the American people. You keep saying Obamacare ain't no good. Obamacare ain't this, that, and the third. Okay, then make a plan for y'all to fix it. But they don't want to fix it. They don't want to fix it. Shut your dumb ass up, blood fart. The only amount of money you pay every month for healthcare is about 17 cents. Shut your dumb ass up. You don't even know how much you pay in health insurance or to help anybody else. Man.
Caregiver for her children, all 4 of whom have disabilities. Her husband runs his own business. He also has a chronic health condition. So Nicole and her husband get their health insurance on healthcare.gov, and their premium is set to triple in January due to the expiration of the enhanced tax credits. Nicole told me that she does not know how her family can pay thousands of dollars more for insurance next year. And I'll also add that Nicole's children with disabilities have been covered by Medicaid. But because of the changes in the great big bill that was passed in July, 50% of America's children are covered either by Medicaid or CHIP insurance. They are now not sure how her children are going to qualify for health care if some of the changes to Medicaid present barriers for that coverage. My office has also heard from Juliana in Sharon, who runs a small business with her husband and counts on healthcare.gov to get health coverage for herself, her husband, and her 2 children. Juliana is facing a premium increase of $600 per month next year, an increase so large that her family may not be able to afford any insurance at all. These are just 2 stories from the constituents who have reached out and urged me to protect their health care. So as we talk about reopening the government, the Democrats are very clear. We need to take care of these enhanced tax credits. They expire at the end of the year. People are in open enrollment right now. If you want coverage starting January 1st, in New Hampshire at least, you got to choose your plan by December 15th. And know whether you can afford it or not. And we know if a whole lot of people drop their health insurance, not only is it devastating for them.
What part of, I don't understand. What part of some people can't afford to work? No. What part of some people can work and still not make enough money? What part of that don't you men get in the chat? What part of that don't you get? That people can work. 2 people can be working. 2 old people, 2 young people, 2 handicapped people, 2 disabled people can be working and still can't afford all of this extra shit like goddamn life insurance and medical insurance. What part of that don't y'all get? I don't understand. Are you slow? Because every time I turn around, I hear you men talk about, I don't want people paying I don't want to pay for other people's shit. Bitch, you just paid for all those goddamn men to get those subsidies this summer. Bitch, you are a part of a social contract with this country. You're paying for it anyway. Why the hell do we have to go round and round with y'all about this goddamn social contract that you already paying for? Why the hell are y'all fucking slow and you don't get that you already are paying for it? The whole point is to make it more efficient so the people can get off of it. All I hear you say, I don't want to pay for nobody's shit. I don't want to pay you. Don't nobody give a fuck what you want to pay for and what you don't. You have to pay for it anyway. You're already paying for it. Shut the fuck up. You're already paying for it. You didn't say nothing about giving billions of dollars to fucking Israel or goddamn Ukraine or goddamn Argentina. Shut the fuck up. I ain't never seen so many goddamn black men caping for rich men in all my life. It's mostly you black brothers be over here on your knees for other motherfucking rich niggas. Instead of dealing with the poor people like you should be helping the poor people, you over here on your knees for the rich niggas.
But it also drives up the cost of private insurance of those employer plans, because the fewer people who have coverage, the fewer people end up bearing the brunt of the overall healthcare cost, which in this country is too high, and that is something we should work in a bipartisan way, and there are lots of bipartisan proposals to do that. But that does not change the fact that at this moment, in this country's time, millions of people are facing huge increases in their health insurance bill that is going to further undermine.
I don't know what the hell you talking about, Black America, but all I hear you say is you don't want nobody living off your dime or your money going to anybody else. Yet you ain't got a damn pushback word for Donald Trump when he pay for all these wars or give these goddamn farmers money or give this money to Ukraine or give this money to Argentina. But you ain't worried about none of that. Billionaires can't go without. But y'all scared that Becky is gonna spend $30 on a steak. Y'all wild. Get your ass out of here, Mike. You one of them zombies. Get the hell on.
An already fragmented and difficult to navigate
I don't have
and
no
expensive
patience for zombies.
healthcare system, and just
Gotta
drive
start thinking
prices
shit through.
up. So when Democrats say we want to do two things, we want to reopen the government, and we just want to extend an already existing premium subsidy for a year so we can continue to work on the very issues that I think there's bipartisan agreement that we need to do on. So I just want to lay that out there because we need to reopen the government. But the two things, reopening the government and making sure people can afford their health.
I'm saying instead of these people in Congress talking crazy about health insurance, get everybody on the same page with trying to fix the health insurance. Fix it somehow, some way, so people can have health insurance. So people's shit ain't expensive. Get everybody on the page. Don't just throw everybody to the wind. I don't want to hear about lazy people because not all lazy people get free shit. And it ain't really free shit because I don't even know where y'all get that shit from because it's your goddamn money. So it ain't free shit. So when people say, oh, well, we don't want to give people free shit, it ain't free shit. You paying for it. It ain't free. Is it free to you? Okay, then stop it. Everybody pays into that. If you're not physically able, if you're elderly or whatever, that's the whole point of having a system that you pay into so that when you need the help, it's there for you. So when these people need their help, it's there for them. It's not just lazy people that are on the fucking system. Y'all wild. And you know what? That sound like some white privilege shit. That's what that sound like. That sound like some white boy privilege shit. Oh shit, these lazy motherfuckers need to get off their ass. I made it. I pulled myself up by my bootstraps. I'm doing my thing. Shit, what all these lazy people doing up on here? These old people need to get the hell on. These disabled people need to get the hell on. These veterans need to get the hell on. That's wild. No, you need to get off your knees for the rich man. Get off your knees, Mike. It ain't no good look.
Healthcare this coming year at a time when everything else in their life that they absolutely need to pay for, from rent, mortgage, healthcare, energy, childcare, is too expensive. This is a time to address that affordability issue, and we can do it in a way that is a win for the American people while we reopen the government. I did have a question, and I'm sorry I wasn't here when you introduced yourself. Is it Verstegen?
It's Shauna Verstegen.
I don't understand what's going on, Rainbow Kid. I don't understand. How y'all didn't have no pushback for Donald Trump when he took your money and gave it to them rich motherfuckers? You ain't had nothing to say, but all of a sudden, let Keisha go over there and get a steak. And they over there bitching about her taking their money to buy her some expensive shit. Ain't got nothing to say about the rich man and their money. They over here caping for rich men. The men over here caping for rich men. That's wild.
Verstegen. Okay, so Ms. Verstegen, in your testimony, you mentioned your family's experience with Huntington's disease. Some of your fellow witnesses have testified that people simply don't need health insurance coverage. Can you talk
Mike, you sound like a zombie. You really need to get yourself together. You sound like a zombie.
about the uncertainty that your family faced before you had
Me and you both, sir. Me and you both. We both sick of this shit.
insurance options provided by the Affordable Care Act?
Yeah, absolutely. It was a very scary thing for myself and everybody in the Huntington's disease community. One of the decisions we all took in before we decided to test to find out if we had the gene that carried Huntington's was, would we be able to get insurance? And a lot of people decided not to test for the disease because of that fear. Luckily, again, because I had the confidence in having the Affordable Care Act, I was able.
Mike, stop talking the dumb shit. You didn't have no pushback for Donald Trump giving those rich people your money. Shut the hell up about poor, disabled veterans and elderly who need that fucking money. Shut your ass up. You didn't have nothing to say about the rich men. Don't you have nothing to say about Bum Keisha?
To test, and I did test negative. I did want to point out, and she's not here anymore, but I do wonder, those farm families, I feel like I have a very similar story. Right. And I'm just wondering how it's going to help them to not let them have the expanded premium tax credit for next year as well. We all do need that for our affordable care.
Thank you so much. Thanks, Mr. Chair.
So, point of clarity, I don't believe any of the other three witnesses ever implied, much less said that people don't need insurance.
Yes.
That never happened. The other point of clarification, because I think it's lost, is the subsidies don't go away. Obamacare subsidies remain in place. The way Obamacare was originally designed, up to 400% of poverty level. At most, people pay 8.5% of their income on their net cost, correct? Is that correct? So let's understand that. What's going away are the temporary COVID subsidies that Democrats scheduled to expire. It was a little help during COVID.
Wait a minute, how y'all gonna be able to pay what you pay and have money to move in? I'm trying to figure out. I'm trying to tailor it so we all have money to move what we got to move.
And
Senator Blumenthal.
And Mr. Chair, just I will add that
Shouldn't it-
regardless of how we got
Yeah,
here, this is
everybody-
where we are. A
shouldn't
60-year-old
everybody,
couple in New Hampshire earning
everybody gonna be out of
$85,000 a
this
year
shit
is
by
going to see an increase
out
in
of
their
it
premiums
by
without
February.
the enhanced
You
premium
can't
tax credit
extend your
of
fucking
$15,000 more a year. I don't know how they make that, and they will end up either bankrupt because of their health condition or just foregoing care, which drives up costs for all of us. I'm sorry to not be able to stay longer. I have to go back to a meeting, but I appreciate this hearing very much.
The first step in solving any problem is admitting you have one. That means acknowledging the damage
why
done
are
by
you
Obamacare. I'm
calling
happy to
me-
work with you to repair that damage. But if
You're
you're not willing to
calling me-
acknowledge it,
I don't
and all you
need
want
help
to do
with
is
money
throw
at all.
hundreds of
I
billions
just
of
call
dollars
and put
to
money in the
mask
bank in 5
the
minutes.
failure of
do
Obamacare,
you want?
that's what we're not signing up for. Senator Blumenthal.
Thank you. You know, I'm struck by your story, Shauna, and the choices that you have to make. You're facing $2,400 more per year in health insurance costs, correct? And when do you have to make this decision about what to do?
Well, we're still holding on to a little bit of optimism that everybody can come back to work and come together and help us.
Extend the
Yes.
taxpayer, the
And that
tax
truly is the
credits.
difference between that and my husband putting in his application to Costco in a few weeks.
So the decision has to be made right now. You can't make it.
Yes, we have just over a month.
You can't make it at some point in the future when Republicans get around to providing a healthcare plan of their own.
And we realize there is a lot to fix, and I truly hope.
lot to fix
I truly hope
because-
you can all work together to do that, but we're talking about our premiums going up in just a short amount of time. And I know that these problems aren't going to get solved then. So please help us so that we can afford our premiums in 2026.
And the affordability question is here and now, at your kitchen table, in real time. When you go back to Wisconsin, and you face that decision, it's not, maybe we'll reform the ACA and, to use the chairman's term, dismantle it and replace it with something else, something indeterminate and right now undefined. You have to make these choices right now. That's what Americans are doing, correct?
Yes, and we have that Costco application on our kitchen table.
And the alternative for you, and I'm quoting you, looking at your husband finding another job, considering shopping for a cheaper plan with a higher deductible, or going without insurance at all. I think I know the answer, but why is that scary?
Well, obviously with 2 children, going without insurance, we talked about it, but then we felt extremely guilty and realized that would not be a smart choice for our family. And we did shop, actually, and and as has been discussed by everybody, we weren't able to find anything a whole lot cheaper. So we are where we are right now, and I wish we could cut more out of our lives, but we've already been working on that. And again, it's not just those healthcare costs, it's our groceries, it's our gas, it's everything going up. So I know it's just over $200 a month, but that does make a really big difference for us, and we're hoping that we can save that.
This morning, I met with a number of Americans from all around the country facing that same decision. I have transcripts of their remarks, including Aaron Lehman, the president of the Iowa Farmers Union. I'd like them entered into the record if there's no
Objection.
objection. Thank you. I want to come back to something that the chairman said to you before, and I'm quoting him directly, Chairman Johnson, quote, "That is Obamacare's faulty design. It forced individuals like you, individual policies, to bear the full cost of people with pre-existing conditions. Prior to Obamacare, we had something called high-risk pool. It worked great," end quote. Now, Shauna, when you explicitly asked what you would be expected to do if you were diagnosed with Huntington's disease, which is a deadly pre-existing condition, or the people like your mom who have it now, the Republican chairman said, and I quote him again, quote, "We would have done high-risk pools," end quote. These are highfalutin, fancy healthcare terms. So in simple terms, what it means is if you are sick, if you're disabled, if you're dying, the Republican plan is for you to pay more in the high-risk pools. You're grouped together with other sick people, and you all get to pay more. That's what they seem to want to do, which is rolling back. It is regressing. to a very dark time in the history of healthcare in this country. And I know it well because as Attorney General of the state of Connecticut, I went to bat for people who were denied coverage because they had these so-called pre-existing conditions. I don't want to go back to a time when sick people paid double for their health care, or they went without health care insurance and health care entirely. Can you talk about what that would mean for you or your family?
Yeah, absolutely. I actually, before the ACA, I remember having meetings with our state chapter social worker, the Huntington's Disease Society of America social worker, and discussed the pros and cons of testing and how to go about it. And we looked into options.
But ain't nobody come up with some other thing. Everybody keeps saying Obamacare is messed up. Obamacare need this, that, and the third. But nobody came up with an alternative. The Republicans said they were going to come up with an alternative, and they never came up with an alternative. They got all these X, Y, and Z bad marks against Obamacare, but none of them want to come up with an alternative. So why don't y'all come up with an alternative so we don't have to deal with these high premiums? But for now, seeing as how, everybody don't understand. The Republicans just cut Medicaid. That includes the subsidies that the Democrats are fighting for. They cut those subsidies in the summer when they passed the big, beautiful bill. The Republicans put us on this road. The Democrats said, you're going to make everybody's prices get high, but you ain't got nothing to replace it with. It'd be a different story if the Republicans had something to replace it with, but they don't have anything to replace it with. So what are we just going to do? We're just going to let everybody's insurance go up? You're going to let everybody's insurance go? You're going to let people who got pre-existing conditions get kicked off of medical insurance? People who got pre-existing conditions not be able to have medical? I don't understand what's the end game with this X, Y, and Z. I don't understand what the end game is.
If I did have a positive test and there was not a single affordable option. In fact, I'm not sure if there were any options for me for that. Like I said, luckily, I did not test positive for that. However, it's very important for me to know for the future of my children that no matter what comes their way, they will be able to have health coverage.
Now, the Trump administration is actually taking some action on health care. It has taken some unfortunate action, which is to increase the potential deductibles. It has issued new rules to increase deductibles. How would that kind of rule affect you? In other words, letting insurers charge higher deductibles as a solution to, quote, improper enrollments. What would it mean for your family if your deductible were to double next year?
That would be a big no, thank you. That is absolutely not help. We do have things come up. We are a healthy family. We have sports injuries and things like that. So having a high deductible does not help the situation at all.
My time has expired.
Okay, some more points of clarification. The ranking member has a tendency of quoting me out of context. I don't appreciate it. I believe when I used the term dismantled, I talked about the way Obamacare dismantled the individual markets and caused, through its faulty design, premiums to skyrocket. When I talked about high-risk pools, I'm sure I always add, they weren't perfect. They would have some modifications to make sure that people...
How exactly would that help in Lexus? How exactly would that lower? No. How would that help prices? Please put it in the chat. I would love to know how deregulating insurance markets would have an immediate effect on helping health care coverage. Please put it in the chat. We would love to know how that would happen.
With pre-existing conditions were covered. Every state high-risk pool were different. Some worked better. I'm saying Wisconsin, the way it was set up and what it did, it worked beautifully. It worked beautifully. Take a look at the successful models. I think they had a great model in Maine, correct? But anyway, that's Senator Scott.
Thank you, Chairman. So, Ms. Ferguson, what did you pay in 2019? What did you pay a month for your health care?
Just keep asking these numbers. Let's see, 2019. What did we pay? I believe, oh boy. 2019, I believe was
I'll
our,
help you out.
was
Our
our,
staff
will
said
you
you
help
said
me? You've got the
1,000.
numbers.
It
I
was
believe that was our, before we dropped to a lower tier plan, $1,000 a month, yes. That was
What'd you pay in 25?
this past year, $460 a month.
So why should it go down? Did your income go down?
What's that? We selected a lower tier plan. And then we also have the extended premium tax credit that's helping us too.
Okay, and so if the Biden COVID era, what would it go to? If those were extended, what would it go to?
So what would it, well, I don't know exactly what that would add on, but currently this year we have about $800 in assistance from the extended premium tax credit. So I assume it would help us at least another $200-300 next year.
You don't make less than 400% of poverty, right? Your family doesn't?
No.
Okay. All right, Dr. Blaze. So Senator Hassan said that in New Hampshire, I guess, that a family of two, if they, if we don't extend this, a family of two, it just skyrocketed, the premium. So what actually would happen if it was a family of two in New Hampshire? Do you have any idea? Aren't they within 400% of poverty and wouldn't, so there's almost no change?
So the underlying Obamacare subsidies, which the chairman said are permanent and aren't going away next year, they are very large. They limit the amount of premium that people have to pay for a plan. So as premiums have skyrocketed over time, the enrollee share has basically remained the same. The vast majority of enrollees are lower income, and they will continue to receive large subsidies next year. So the vast majority of the premium for the vast majority of enrollees will be paid by
It's only 50% of the people that are overweight, blood fart. Get your numbers right. Only 50%.
The federal taxpayer.
That's everybody.
Most
including white,
enrollees will
black,
pay less than
Mexican,
$80 a
you name
month for coverage that costs, up to $1,000 a month for single coverage because of the design of the credits. The subsidies in Obamacare only went up to 4 times the poverty line. The idea was that coverage, one, they were trying to limit the cost, but those people didn't need subsidies.
Are we paying $1 per pound? We paying $1 per month? Let's start with your wife, blood fart. 300, it sounds good. Sounds good to me.
At that level. The problem with Obamacare is it has so increased the price of coverage over time, particularly for older couples, that it has led to very high premiums for them. So they do face higher premiums above 400% of the poverty line if the subsidies expire. But it's a very small percentage of the overall Obamacare enrollees that have that income.
But if you're in New Hampshire, you're making $85,000, you're probably within 400% of poverty, aren't you?
For a couple of two.
Wait a minute. Did you just say that Trump has a ACA or Trump has a medical plan? Is that what you saying, Lexus? Trump has a medical plan? What are you talking about?
You're probably just above four times the poverty line.
Okay, so your number's not going to change.
If you're under 400, you will still get a large subsidy. But it's the people just above 400 that are
who
going to face
designed
the
that?
largest.
Did the Democrats design it that way?
That was one of the main features of the 2010 law, yes.
Okay. All right, why would they do that? I mean, this is their design, they were supposed to, and I assume they were generous and covered the people they thought they had to cover.
In
even excess.
2010, in 2009, President Obama said he would not sign legislation that increased the deficit by a dime. Now, once the law was signed,
Supposed to save like $100 billion?
there were several financing gimmicks. There was a student loan takeover, which has clearly cost money. But what Congress has done is repeal the health insurance tax, the Cadillac tax, the medical device tax, the independent payment advisory board, most of the cost savers in the law have been repealed, which leaves just a giant spending
So what's the deal?
provision.
They reduced the cost of Obamacare, didn't they? They wouldn't have reduced.
And this has gone on week after week after week. Let any toxic president, attack the people of the city of New York. Tens of millions of Americans are seeing their health insurance premiums skyrocket, making seeing a doctor for themselves, their children, and their families unaffordable. At the same period of time, in these appropriations bills, Republicans are trying to gut the Centers for Disease Control and the National Institute of Health and undermine the ability of everyday Americans to actually receive.
He's trying to get in so that people pay him for health insurance. He is the most manipulative, trash human being and president ever.
Vaccines. This Republican healthcare crisis is real. That's why House Democrats are standing up for the American people. It's not a partisan thing. It's a patriotic thing. That's why Senate Democrats are standing up for the American people. Not a partisan thing, a patriotic thing. We have to decisively address the Republican healthcare crisis. And John Thune is divorced from reality. I mean, it's a clown show over in the Senate. 14, 15 times you bring the same partisan Republican spending bill to the Senate floor, expecting a different result. That's the classic definition of legislative insanity. Doing the same thing over and over and over again, has no ability to actually negotiate in good faith. And this has gone on week after week after week.
Mr. Leader, thank you. Good morning. I understand the Democrats' concerns about health care and the arguments that you've made about that, but do you think at some point with the crisis in the aviation industry, cutting off these flights, people concerned about air safety, air traffic controllers not getting paid, do you think that the air question will pivot some of your members and say we have to open up the government because we're worried about people flying?
We want to immediately reopen the government. We want to find a bipartisan path forward to enacting a spending agreement that actually meets the needs of the American people and actually drives down the high cost of living. What about what happened on Tuesday? Do Republicans not understand? They got wiped out all across America because they've made this country too expensive and they failed to do anything about the affordability crisis. And as Democrats, our position is simple, and we're doing this for everybody. Whether you're a Democrat, a Republican, an independent, we're doing this for everybody. We have to lower the high cost of living in the United States of America. And we have an opportunity to try to do it with respect to health care. But the Republicans refuse to extend the Affordable Care Act tax credits. On the aviation safety issue, we need a full and complete briefing so we can understand from the administration what the current status is, what the impact of administration layoffs have been prior to the Trump Republican shutdown, because the administration has been going after the FAA since the beginning of their time in office, since January 20th. And we need to understand how we got to this moment, separate and apart from the Trump Republican shutdown. The problem is it's like impossible to have a congressional briefing with House Republicans on vacation. 6 consecutive weeks they've canceled votes. I mean, it causes you to answer or ask the question, is there such a thing as a 4-ring circus? Because it's a circus right now in the House, in the Senate, across the country with Republicans, and certainly at 1600 Pennsylvania Avenue.
Mr. Leader, did the former speaker notify you of her decision to retire, and does her retirement signal a shift in generational leadership for Democrats?
Yes to the first question. To the second question, we are all proud to stand on the shoulders of Nancy D'Alessandro Pelosi. It's been a great honor for me to be able to serve with legendary members of Congress from the very beginning of my time in office. And that, of course, includes, right at the top of the list, Nancy D'Alessandro Pelosi, or John Lewis, or Charlie Rangel, Elijah Cummings, Eddie Bernice Johnson, John Dingell. We can go through the list. These are legendary members of Congress. And of course, right at the top of that list is Speaker Emerita Nancy Pelosi. Thanks.
Speaker Johnson says he won't even guarantee a vote on the ACA issue. Can you react to that?
Well, Mike Johnson has claimed over the last several weeks that Republicans are the party of health care. That's a joke. Why does this guy keep lying to the American people? Week after week after week, it's a new story. Because for several weeks, we were told that Republicans had a health care plan, and that Republicans had planned all along to address the Affordable Care Act.
That's why you already know they come in bad faith when they say they got to get off their boot, they got to get off their butt and work and afford health care. They already come in bad faith. Don't engage with bad faith. It's just bad faith for them.
Issue. And the fact that these tax credits for working class Americans, middle class Americans, and everyday Americans are about to expire. And Republicans can't be bothered. This from a group of people who somehow found $40 billion to bail out their right-wing dictator friend in Argentina. $40 billion to put Argentina first, not America first. Republicans have put Argentina first, and they can't find a dime to extend the Affordable Care Act tax credits. This is part of the reason why Republicans were rejected all across the country, pummeled, shellacked, beaten down electorally all throughout America, because they have failed to address the affordability crisis. And instead, everything that these Republicans do, including their one big ugly bill, is about providing massive tax breaks to their billionaire donors and subsidize the lifestyles of the rich and shameless.
Thank you, Leader Jeffries. With Speaker Emerita Pelosi not seeking re-election, this coincides with Mayor-elect Mamdani in New York City. So as he is on the shoulders of Speaker Emerita Pelosi and looking ahead, how will you work with him to make New York City better?
Well, as I've indicated, it's incumbent upon all of us, everybody in New York City, to make sure that the mayor-elect is successful. People who supported him and people who did not support him. There's a time for politics and there's a time to govern. And when the mayor-elect is inaugurated on January 1st, it's a time to govern.
Just going off of that question then, how would you advise the mayor-elect to approach the president in how Trump has been threatening to withhold federal funds from New York? I guess how would you advise him to go about handling?
Yeah, those private conversations will remain private, but we are not going to let any toxic president, attack the people of the city of New York.
Thank you, Mr. Leader. So you're saying that you want a bipartisan deal and that you have to address health care. I just want to clarify with you then, what you want is an ACA subsidy extension to be either in a CR or legislation that will get a vote and will pass?
We're not going to negotiate the specifics in public, but as we've repeatedly said, we have to decisively address the Republican health care crisis, and that begins with dealing with the Affordable Care Act tax credits.
To build off of that, would you see, because it seems conversations are continuing over on the Senate side, at least amongst the ranking files, would you see a standalone ACA vote as a cave? And what is your advice to those ranking file members right now?
What we have repeatedly said as House Democrats is that we will consider anything in good faith that is sent over to.
He wants somebody to enroll in his plan so he gets paid. That's going, oh, Lord have mercy. The Republicans have nothing. They have Just take everything away and expand Medicaid and Medicare. That's all you need to do. Expand Medicaid and Medicare and leave it alone. But they didn't want to do that because that's a single payer. That's socialized medicine already. Medicaid and Medicare is already socialized medicine. Just expand it. Expand it to include the American people. That's all you got to do.
Us from the Senate in a bipartisan way. But it has to have a path toward decisively addressing the Republican health care crisis, beginning with an extension of the Affordable Care Act tax credits. Thanks. All right, lastly, let me just say, Trump has stunningly made the point that the economy in this country is going well. It ain't going well. Everyday Americans know that they are working hard, they are playing by the rules, and they cannot get ahead. They can barely get by. The cost of living in this country is way too high, and Republicans are clearly out of touch, focused solely on the wealthy, the well-off, and the well-connected. As Democrats, we're going to continue to work hard to drive down the high cost of living, to fix our broken healthcare system, and to clean up corruption, to deliver an America that works for working class people. Thank you, everyone.
When they're spending and getting $9 in federal money for every dollar of state funding. Like Obamacare is significantly contributing to federal deficits and debt.
So, Mr. Biden, can you walk us through the fiscal impact of erroneous or fraudulent Medicaid enrollment that stems from Obamacare's relaxed verification standards? I'll just give you some numbers when I was governor. So when I walked in as governor, January 2011, we had a horrible economy. So over 8 years, I worked on, we added 1.7 million jobs. We took the number of people on unemployment from over 900,000 to 61,000 by getting people a job. We reduced the number of people on welfare from over 250,000 to 71,000 by helping people get a job. And I don't know if you know the numbers, but as part of this no verification, this crappy verification, what's happened? I know I think in Florida, it doubled, Medicaid population doubled in that time frame, in which, can you talk about the fraud in Medicaid?
Sure, there's two different ways that fraud happens in Medicaid on the enrollee side. You have somebody who's enrolled who's not eligible, and there's a bunch of mechanisms where somebody who's not eligible can be enrolled in Medicaid for a period of time before they're then disenrolled. But you also had, during the Obama administration, you took away states' ability to verify income and eligibility more regularly.
Why would they do that? I mean, that doesn't seem to make much sense. That actually would allow fraud.
It would, because
That
you
was
have,
intentional?
it was, they changed the
It
rules.
was intentional? They wanted more fraud?
Well, there's a lot of incentive for it because a lot of individuals make more money when they
would-
remain on the
If
program
it wasn't
longer.
to increase the fraud, why would they have done it?
I wonder the same thing.
So can you talk about provider tax, how that is, has cost the federal government massive amounts of money and basically allowed our states to just completely take advantage of the federal budget and federal taxpayer?
So the provider tax is probably one of the craziest money laundering schemes sanctioned by the federal government for states, where states can tax Medicaid managed care plans or they can tax Medicaid providers. Those providers pay the tax to the state, and then the state increases the payments to Medicaid managed care or to providers and draw down federal money.
Do they get the money back?
They do, and sometimes they get back even more than they collect, both on the provider side and the state side, particularly in Medicaid expansion states, because you have that $9 in federal money for every $1 in state money. So you have these incredibly perverse incentives to launder money from either Medicaid providers or now local governments to send that money to the state for the state to draw down additional federal money and then to use the difference for whatever programs they want and call it general fund money.
Thank you, Mr. Chairman.
Thank you. Okay, more clarification here. We've been hearing premiums double, premiums triple. First of all, do any of you know of any gross premiums that are doubling or tripling? Again, I put up the national average going about 26%. So what we're talking about is we're talking about net premiums, correct? Put this chart back up. I want to just show you this, Senator Scott. And again, trying to use Ms. Verstegen's example here just to illustrate. I'm not saying this is exact, but in terms of the numbers you've given us are this year you're paying $460 net, correct? And you got an $800 subsidy. That means your gross premium was $1,026 or $1,260. Okay, so you can see what the annual amounts in that would be. The other thing you've been telling us is you're going to pay about $700 this year if the enhanced premiums go away or enhanced subsidies go away. So again, we looked at a bronze plan. And what's so difficult about this is the premium rates are all over the board for different ages, and so it's just hard. So you can only take a look at one example, but I think this is, and I'm really asking our witnesses, does this look right to you then? So if that's what she paid last year and she's going to pay $700 this year, that means her premium, if it was going to go up 26%, it may not because Wisconsin is actually less, but somewhere in the $1,500 range, she'd be getting a subsidy of about $888, so more than she got last year, correct? And on an annualized basis, last year she got almost $10,000. This year she get more than $10,000. So what's going up is her net premium. And I'll keep arguing the reason your net premium is going up is because the gross premium is going up by a grotesque amount because of all the things we're talking about. There's no incentive for lowering costs. All the incentive is for insurance companies to keep raising their premium, and they get away with it because the federal government's their customer. The federal government, and the federal government's got Democrats that are just happy to throw hundreds of billions of dollars at the problem to mask the faulty design of Obamacare. That's what's going on here. So again, both Senator Scott and I, we are more than happy to work with Democrats to repair the damage of Obamacare, move to a system that will actually provide incentives. And that's generally through consumerism, through free market competition. All that's been driven out of healthcare. I mean, one of the things we talked about with Mr. White was the reliance on a third-party payer system. Again, we went from many, many decades ago where patients pay for 80% to now we pay for about 10%. So nobody knows anything costs, and nobody cares, other than everybody cares about their insurance cost. But when you don't care about the gross premium costs, because the federal government is subsidizing you to the tune of about $10,000 a year. You don't care about that. You don't care that it's $19,000. You just care about what you're paying. And I understand that, and families are struggling. But let's at least be honest in terms of what's happening here. I've got an article just came out today. Again, this is the media putting pressure, extend these things because there's a couple, apparently, I'm not sure this person actually exists, 60-year-old couple making around $85,000 in Barron County could see premiums skyrocket over 800% with an annual increase of $33,000 in costs. And I went, that's just not possible. But it is. That's what the premium is for a 60-year-old couple, $33,000. Now, it's going up that much because they obviously make more than 400% of the poverty line. And this is a couple, I don't know, we'll assume one of the reasons they thought they could retire, because they're retired. They don't get it through the employer. So these enhanced subsidies incentivize people to retire early, knowing they weren't going to have to pay much for health care. They weren't looking at the way the Democrats designed those enhanced premiums to expire, and that they weren't going to be able to afford the unaffordable Obamacare. But just speak to that incentive, because we've heard this time and time again, and I think it was Dr. Blaze or Taryn talk about it's a kind of small group of people that aren't eligible yet for Medicare, who retired early, relying on those enhanced subsidies, and when they go away, because they make more than 400% of poverty level. Again, Obamacare was designed not to provide any subsidy to anybody making more than 400% of the poverty level, which is I don't have that number. What is that for a family? It's like $123 a year, isn't it? For an individual, it's like 60 some.
Yeah, 123,000.
So if you're making more than $120,000 under original Obamacare, you didn't get any subsidy. Under the enhanced subsidies, sky was the limit, basically.
Yeah, I
right?
mean, there was a news article a couple of weeks ago about an early retiree couple. They'd worked in government for 30 years. They had a $140,000 pension, and they, because of the COVID credits, qualify for a $15,000 subsidy now towards their health insurance. There's no asset test on these subsidies, right? You can have unlimited wealth and qualify these subsidies. It's based on income. Enormous incentive for, particularly if the enhanced subsidies are continued, for couples to retire early. We're also seeing big incentive for cities and states to dump their retiree health plans into the exchanges. So the Wall Street Journal had a piece discussing how Detroit and Chicago had offloaded the cost because it was underfunded retiree health plans onto the federal government through the exchanges.
I think they call them the Blue City subsidy.
Bailout.
Well,
And I'd say so the market in 2013, the individual market was unsubsidized. In the pre-COVID credit era, the market was 75% subsidized. Now it is approaching a 90% subsidized market. There are alternatives. So when I moved to the state of Florida 5 years ago, I looked at Obamacare plans. Obamacare plans, when I called the doctors asking about the plans, they just equated them with Medicaid because they have such bad networks. I then looked at short-term limited duration insurance, which is a plan that the Trump administration had opened up for 3 years, much more flexible, covers a far broader set of providers. I was able to get my family on a short-term limited duration plan with basically a comparable deductible, much broader provider network for 1/3 the cost of what the Obamacare plan would be. So the point is we need more competition, we need more options. Unfortunately, the Biden administration has restricted that ability to access it. So people don't have options other than this one market where the government is dumping all the subsidies into it.
again, I bought healthcare for my business for 30 years. And every year you'd have to negotiate. You'd have a number of carriers coming in. I mentioned that one year somebody came in and offered us zero deductible plans. Like, great. I mean, at the same price we were paying, I think back then we probably had $150 deductible, out-of-pocket maximum for a family, $1,000. Again, I don't remember the exact, but I mean, that's the levels we were at. When I left, I really do not believe I ever had for one of our health plans more than an out-of-pocket maximum than $5,000 for a family. I could be wrong, but that's about where it was. Then I hear Mr. Verstegen here, the $14,000 deductible. Again, those were the catastrophic plans that didn't cost like anything because it's not insurance. So again, I am more than happy to work with anybody who's willing to acknowledge this reality. Again, you cannot solve a problem unless you first admit you have the problem, then you have to properly diagnose it. You got to do root cause analysis. This is what's driving insurance premiums up. You don't mask it. Again, when you've got a crumbling structure, you got rusty beams, you don't paint over it and then move in. You replace the beams. I mean, there's something structurally wrong here. And there's something really structurally wrong with Obamacare. So it's not like we don't have hearts here. I feel a great deal of sympathy for all of the victims of Obamacare, and there are a lot of them. Okay? I'm happy to provide some kind of bridge for people that, again, had no options. You have no options because of Obamacare. So it's going to take us a while to transition to a system that works. I'm happy to do that, but I'm not going to do it with folks on the other side that, again, take your comments out of context, just absolutely refuse to admit that the structure of their Obamacare is flawed, faulty, causing all this. Now, if they're willing to look at reality, do it like a business person, go, okay, yeah, we kind of blew that. Let's clean up this mess. Happy to do it. Happy to do it once they vote for a clean CR and open up the government and not hold government employees and the American.
See, the problem is the Republicans lied the last time. they lie straight to the American public. They'll say, hey, y'all vote for the door to be open. Y'all vote for it to open up and we'll vote on it later. And then they never hold any kind of hearings to hear it later. Just like they did this year, they said they were going to hold hearings in order to keep the medical, and they never held them, and then they cut the medical. That's why the Republicans lying about what they're saying.
Population hostage. They've taken their own family member hostage. This is the most bizarre thing in the world. They're the party big government, and they've got the gun to the big government's head. And this is the most bizarre Kafka-esque type of situation we're in right now.
Keeping count, this is day 37. 37. It seems unbelievable to us that we've gone this long. It is officially and shamefully the longest shutdown in U.S. history. Republicans feel very helpless about the situation because, as we've noted, there is really nothing for us to negotiate. We sent them a clean CR, as you know, back in September 19th. We passed it out of the House. It feels like a lifetime ago. But that was a nonpartisan measure. It was 24 pages in length. It has no Republican priorities on it at all. It was merely...
That's what happens when you get in a room full of men. They dick ride each other.
the status quo to keep the lights on so that the members of Congress and the Republican and Democrat Party could work together to finish the government funding appropriations process. And the Democrats tried to turn that into a game. Now, we're gonna give you the latest updates on that and where we think this is headed. But I just first want to address in a bit more detail the current state of our politics. It has been very interesting to us to see all the pundits trying to spin the result.
Mike, we already told you, you didn't have no problem giving money to the men, the billionaires and the millionaires. Now you want to be mad that we want to give money to the lazy people. Get off your knees. You didn't have a problem being on your knees before. Stop acting like you care about being on your knees now. And this way you're on your knees. You're going to have to be on your knees regardless.
I just want to point out some simple facts here, and as usual, I try to be concise and give you the highlights here. But there's some things that we really need to point out. First, there were no surprises on Tuesday night. Okay, you had blue states and blue cities that voted blue, to the alarm of no one, to the surprise of no one. That was what was expected. It just so happened that New York and New Jersey and Virginia were the states that were in the national spotlight on Tuesday. If the tables had been turned and if the calendar had been different and you had 3 red states, we'd have an entirely different narrative that you all would be writing about. Don't lose the simple facts. Second, the big headline that
I want them to do the filibuster, Mike. I want them to do the filibuster, Mike. Please do the filibuster, Republicans. Please do the filibuster. Please do the filibuster. Please. You think they had a blue wave yesterday? They will have a tsunami come next November. And we gonna make them get everything we want. Make them do everything we want.
everyone is writing about appropriately is that the future of the Democrats was set in New York City. A 34-year-old Marxist is now the leader of the Democratic Party. And it is a...
What did I tell y'all? Didn't I tell y'all the minute the Republicans come out after getting their ass shellacked, they were going to all come out talking about Marxist, Antifa, communists, socialism. You notice that they all come out there and do that same thing. Every last one of these people that come up to the mic probably gonna say something wild and crazy about a Marxist, socialist, Antifa, taking over the government. We going down a weird road. Watch this shit. Watch this shit. Every last one of them are gonna say that weird shit. Watch.
Very dangerous road for them to go down. I want to say this because a lot's been said about the Mamdani campaign.
Because the Republicans ain't got nothing but fear tactics. That's all y'all got. You don't stand for nothing. Everything you got to try to make everybody scared of everything. And for sure, the black men are scared. That's for sure. Because you ain't got one black man standing up there saying nothing natural or nothing with all the black people that work there. You ain't got one black man standing there saying, y'all full of bullshit. Every last one of these people that step up to the mic gonna say something crazy. Socialist, communist, down a weird road. That's y'all. That's the leader of y'all Democratic Party. You Democrats are social. You Democrats are dangerous. Watch every last one of these people. I bet you.
Campaign, it is very easy to run and win as a socialist, right? All you do is promise everything to everyone for free. What a great message that is. Boy, that really resonates for people who don't study history. And while you're making all those promises, you hope that they never realize the trap that you're actually setting, the impossibility of fulfilling your fantastical claims and dreams, and the extreme danger and chaos that would result if you ever could. When you run as a socialist, you have to hope that they never understand that this will lead to the inevitable loss of their freedom, their opportunity, and their security, the loss of meritocracy and fairness in society, the loss of colorblindness, and the loss of emphasis on character, and the morality and the personal incentive and the common sense that we rely upon to keep a republic in operation. If you run as a socialist, you run on a big list of false claims. You promise everything to everyone and you can't deliver, and if you were ever able to deliver, it will be to the great detriment of the very people that you lured in to vote for you. Third fact about the election on Tuesday night is that the Democrats, and you all are not writing about this and you should be, not writing enough about it, the Democrats have now set themselves on a collision course in their own tent. If you look at Spanberger in Virginia and Sherrill in New Jersey, they tried to run as moderate pragmatists. That's how they self-described. But they will be no match for the coming communist wave taking over their party right now. The energy is on the side of the Marxists. Look no further than the top two Democrats here in Congress. We've noted this here every day. They had to bend the knee to the socialists. Hakeem Jeffries and Chuck Schumer are both from New York. The top Democrat leader in the House and the top Democrat leader in the Senate, they couldn't get around that. And so Hakeem had to ultimately embrace it. He had to give the full blessing to Mamdani and his agenda, and he co-owns it. And Chuck Schumer flirted with it. He pandered all along. He flirted with that open endorsement till the bitter end, even though Mamdani is an activist against Israel and an anti-Semite. Chuck Schumer is the highest-ranked Jewish official in America, and even he couldn't bring himself to disclaim that. And as we've noted here every day, the sole reason for the entire federal government being shut down now, the sole reason for all the American people suffering all this pain and hardship is because of the fear of political retribution from the far-left activists who run the Democrat Party. That is the motivation for the shutdown. It's never been about any policy issue at all. It was only so that they could show a fight and try to show that they're tough to this rising far-left activist base in the party. The old guard has been repudiated, and the radicals are taking over the Democratic Party. We have evidence now every day. Yesterday, Jared Golden announced he would not be running for re-election in the state of Maine. He's a moderate, and he has no place in his party anymore. And then this morning, you saw the headline. Former Speaker Nancy Pelosi has now announced her retirement this morning. That is a very important sign that I hope that you all will delve into. Even the famous San Francisco liberal is not far left enough for the neo-Marxists. We commend her for her services. We all do, everyone who serves in Congress, but there should be a lot written about that. Fourth point I just want to make in the aftermath of Tuesday is that off-year election results in isolated places are never indicative of the upcoming midterm election. Don't read too much into that. You shouldn't. If you do, you're going to miss it. The GOP is in excellent position to win big next year. And when I say I'm bullish about the midterms, we absolutely are. And there's a lot of reasons for that. This is not groundless optimism. It's based on facts.
How does he have facts about? How would you even bring your ass out here and say you think you are in excellent shape? Don't nobody come out here and say no bullshit like this unless they afraid.
The reason we're in such a great position is because we are united. And while the Democrats engage in their emerging civil war, Republicans are going to continue to work and deliver for all the new voters that we brought into the party in last fall in 2024. There was a true demographic shift in that election, as you know. Record number of Hispanic and Latino voters, Black and African American voters, Jewish voters, union workers, urban voters, young people. And while they say that there's this big swell of enthusiasm of young people based on what happened in New York City Tuesday night, I would give to you Exhibit A on our side. Maybe you're not noticing, but the turning point event.
Survey. Y'all keep saying y'all not afraid. I say they're very afraid, and you better be afraid. You better be afraid, because that wave has come.
Republicans are not handling last night well. I think a lot of reasonable people understood that Mamdani was going to win. Nobody expected the broader Democrat victory yesterday. Overwhelming victory in New Jersey, in Philadelphia, in Pennsylvania, in Virginia, in Georgia. Dude, Republicans lost their supermajority in Mississippi. They flipped 14 seats in Virginia. Atlanta shifted farther left than anyone ever expected. Like dozens of points further to the left than the voting was in 2024. It's like Republicans just forgot they had anything to vote for. They just forgot. They forgot. They didn't show the fuck up. The Democratic candidate who had leaked text messages from 2022 where he joked about killing his political opponents, he won by like 6 points. The woman who leaked those texts, the Republican, she lost. It's unbelievable. Total Republican death across the entire country. Prop 50 in California won. Unfortunately, Omar Fateh in Minneapolis lost. Unfortunately, the incumbent Democrat Jacob Frey will be holding his position. That is very sad. Though Omar Fateh ran a good campaign, and if we could just be real for a second, Omar would have won if he was a white guy. Like we can just, we don't have to parse words on this. If he was a white guy, Omar was running at a buff by being a black guy who also had kind of like a little bit of a dead fish-eyed stare. No hate, Mike Ehrmantraut, maybe my favorite character from the show, but it is worth pointing out. You mean nerf? Yeah, massive nerf, debuff. He got a debuff, Seattle mayorship right now, we'll talk about the Seattle mayorship in a second. Right now, I think that her odds are greater than a coin flip. Greater than a coin flip, okay? I'm going to say that. But listen, Republicans are not doing well. You can try to sum it up. You can try to, here's 57 responses from 57 different men, But there's a whole lot of this shit right now from Dan Crenshaw, who no one cares about anymore. Hot take from last night. Despite the media narrative, there was no victory for Democrats last night. That's all you need. Seriously. There's 100,000 Republican takes out there. A lot of them are some version of this. It's unbelievable. I have never in my life seen an off-season election go this partisan. I've never seen this much of an upset in an off-season election. It's unbelievable, genuinely. No one expected it. There were no pollsters. Nobody expected it. Donald Trump immediately rushed to distance himself from the failure of his party, even though the reason his party is failing is because they're tied to him. The Republican Party has no identity outside of Trump. Republican politicians all boast about how close they are to Trump. They have no independent personalities, initiatives, drives, or competence. It's all just about loyalty to Trump. Trump is the only thing any Republican can win or lose on. There's nothing else. And so, with that in mind, Trump is therefore directly responsible for what is happening. Certainly, the shutdown, the SNAP benefits, the healthcare premiums, the ACA subsidies, and everything else that's gone wrong over the past nearly a year now, all of them have contributed to Trump's unpopularity and therefore to the failures of the Republican Party. But they have no exit strategy. In spite of everything, in spite of the fact that this is an obvious weakness for their party, the cult of personality is doing what cults of personality do, which is they are doubling and tripling and quadrupling down.
Last night it was not expected to be a victory.
Speak up.
I don't think it was good for Republicans. I don't think it was good. I'm not sure it was good for anybody. But we had an interesting evening, and we learned a lot. If you read the pollsters, The shutdown was a big factor. We have to get the country open, and the way we're going to do it this afternoon is to terminate the filibuster. And it's possible you're not going to do that, and I'm going to go by you.
Harriet Tubman, Black America. Are you serious?
You're very smart people. We're good friends. But I think it's a tremendous mistake, really. It would be a tragic mistake, actually. We will pass legislation at levels you've never seen before.
Okay, fine. Washington Post, that's fine. If you want to post audio at that level, no, that's fine. That's fine. I'm not mad. I'm not mad. I'll just go to Twitter. Twitter, what are you saying about Trump?
You want to see what congressional Democrats wish to do to America? Just look at the result of yesterday's election in New York, where their party installed a communist as the mayor of the largest city in the nation. Remember, I've said we will never have a socialist elected to any post in our country. I used to say that, and I was right. We skipped socialist and we put in a communist instead. That didn't work out too well.
Please keep talking about him. Please keep talking about him. I beg you. Make him the main character. Make him the interesting one. Trump, people are tired of your bit. You've been doing the same thing for a decade now. I'm sorry. You talk the same that you used to. Yeah, you're funny sometimes. Okay. But he's innovative. He's young. He's groundbreaking. Okay. He's the new hotness. All right. You're fucking old, dog. And you're a pedophile. You're a pedophile, dude. People are over with it. There's no Mamdani in the Epstein files. I assume that would be pretty crazy. That would be a banner day on Twitter. Grijalva gets in, they release the files, just pages and pages dedicated to Mamdani. Somehow. Yeah, I guess if he was in the files, it would be as a victim. That's true. He is that young.
There's nobody else who's going to object. They're going to do it the first day. They're going to pack the court. They're going to make D.C. a state, and they're going to make Puerto Rico a state. So now they pick up 2 states. They pick up 4 senators, okay? You think you have problems? They're going to do all of the things. They're going to pick up electoral votes. It's going to be a very, very bad situation. And it's done. It's done. As soon as they attain power. Now, if we do what I'm saying, they'll most likely never attain power.
The thing that he's saying here is his way of dealing with his record unpopularity and the stunning defeat that it led to within his party is to pass an executive order banning mail-in voting. He can't do that, of course. So the best that he could do is direct his administrative state to not give federal funding to states that allow for mail-in voting. Again, executive orders aren't law. You can't create laws via executive order. Everyone forgets this, but yeah. And by the way, like, it'll never happen. It won't happen. It'll simply never happen. But if it ever does happen, by the way, to all young people, I encourage you to go out and vote same day, and I want you to youth mog all the old people, okay? Take up space in line, kick your feet up, you know? The old people, time's wilting them away, you know? They've got bad knees, bad back. Take up the seats. If it's election day and mail-in voting has been disallowed in your state and you take the bus to the polling station, you are allowed to lay down on the bus seats, okay? Me kicking my feet up like this, taking up 4 seats on the long side right at the front of the bus while a bunch of elderly people are trying to keep their balance on the canes. Sorry, Grandpa. If only you could have mailed in that vote. Well, here's where we are now, and I know what my demographics tend to vote like, and I know what your demographics tend to look like. Except for old black people. Yeah, you have to let the old black people sit down. You know what I'm talking about. You understand the gist of what I'm getting at. You get me. You understand me. Oh, fuck off. Miss Genderlyn, maybe you could put some like shoe polish on to immunize yourself against the, oh yeah, and the rural, you can't let the rural people vote, you know? If you see a person wearing a flannel or a trucker cap, you gotta, unless the flannel shirt is cropped, in which case that's not a ruroid. That's just a fashionable person keeping warm in the cold, you know? The elections do take place in November, so that's a lesbian. That could be a lesbian. That could be a lesbian. Look for the carabiner. They're not doing good.
Times and what I've said here before, the president is on the ballot in 2026. President Trump is on the ballot next fall. Because if we lose the majority, if the
Please keep saying
Republicans, the common sense people here who are doing the job for the American people, if we lose the majority in the House and this radical element of the Democrat Party were able to take over, we've already seen that movie. They will try to end the Trump administration. He won't have 4 years, he'll have only 2, because they will move to impeach him probably on the first day of the new Congress in January 2027. and they will try to systematically unwind all the important reforms that we've done for the American people to lower costs, to have a better quality of living, on health care, to increase access and quality of care. We are the party that is doing that, and the president needs 4 years to complete his agenda, not just 2. So he is in a very real sense on the ballot. He's fiercely committed to us winning. He is going to help. He's offered to do rallies and the teletown halls and all the things. He's sent out a huge round of endorsements of incumbents, Republican incumbents, just over the last few days.
So Mike Johnson's language here that Trump is on the ballot is the exact opposite of what Donald Trump rushed to say when he went to Truth Social last night. Trump explained that the reason the Republican Party did so poorly was because he wasn't on the ballot. This is the death spiral of the Republican Party. It's the thing that, and I'll take credit, it's the thing I've been warning about for years, or not warning about, anticipating. Because I want it. I'm not really warning, you know. If you cannot find a future path outside of Trump, he is far more concerned with his own ego than he is the future of the Republican Party. Trump does not care about longevity. As far as he's concerned, when he dies, the universe ends. All right. He's borderline a solipsist. Narcissists tend to lean in that direction, you know? Right now, yeah, the way the party is set up, MAGA dies with Trump. Like, everything after that is a pathetic, floundering attempt to grasp onto little bits of his power. And all the people in his cabinet are acting this way, by the way. None of them are trying to build a legacy for him. They're all trying to do content creator bullshit for themselves, you know? Half of them have just given up on the job, basically, like Kash Patel using his time as FBI director to do nothing except fly around on private jets and get mad at people who criticize him for it, you know? Oh, did you hear he like shut down an effort from his boss, Tulsi Gabbard, to investigate whether the Mossad took out Charlie Kirk? You've got like Nazi infighting going on over there at the Department of Homeland Security. No, sorry, not Department of Director of Intelligence. Sorry, not DHS. My point is that nobody in the Republican Party seems to be prepared for a world in which Trump becomes the anchor chained to their ankle. You know, certainly not Trump, because again, he doesn't care. As far as Trump's concerned, like the Republican Party can never be more popular than him, because then he would be outshined by them. And if his popularity diminishes and it hurts the Republican Party, why would he care? He only cares about his popularity, you know? I don't know what will come after MAGA and Trump, but I do not think the populist rage is just going to go away. It'll find a new avatar, for better or worse. Yeah, it 100% will, but that doesn't mean there'll be an effective channel. Trump is effective in large part because he's not like the sniveling little groypers who follow in his footsteps, you know? The people inspired by Trump are usually too socially incompetent and obsessed with, I don't know, lolicon to actually be effective, you know? Trump did his pedophilia like a gentleman on an island, okay? The people coming after him, they have no class, all right? They can't lead the Republican Party. J.D. Vance, you can't have 4chan neo-Nazis lead the Republican Party. These people don't have the skills. They don't have the shamelessness required. It's not possible. I mean it. I understand I'm phrasing this in a jokey way, but I mean it. I completely mean it, you know? This is an ideology that's only sustained itself in a political movement because it's being led by a person who doesn't act the way the people who follow it do, you know? Trump isn't going to get more popular, not unless something exceptional happens. If there's like a big terrorist attack, you know, I can't predict the future. Some stupid bullshit happens, whatever, that mobilizes people to consolidate. But like overall, his aggregate popularity, the extent to which people think he is a good man doing a good job, that shit is not turning in his favor. He has nothing new to offer. There are no plans except the continued rape and worsening of the country. So with all that, you know, with the direction things are headed, a Republican Party that was sane would be looking to jump ship, but they can't. So this is what they're stuck with, you know? Last night was devastating for them. Off-season elections have never, at least in my memory, not in recent American history, delivered such a partisan result. And as a result, the sane Republicans are desperately scrambling. But unfortunately, the best way the best way they could fix this would be to do something other than align themselves with Trump. And what they're doing in the meantime is good for Mamdani. the other main character, the only other main character in the United States of America. By focusing on him, fear-mongering him over him, attacking him nonstop, they give him more attention. They will do to Mamdani what the mainstream media did to Trump in 2016. And I remember it, you know? I remember it. A lot of the people who weren't explicit Bernie supporters, like they didn't vote for him in the primary, but were Bernie curious, you know, they ended up liking Trump as well. There is a big contingent of people who are Republicans who like Trump, specifically like Trump, but also are pretty, you know, okay with Bernie. And that's because they're populist, anti-establishment dipshits. They don't really have consistent positions. Trump being the main guy with the main character energy, you know, that does attract a lot of attention. It does attract the interest of a lot of people like that. But as Trump wanes, as his message grows more stale, as he looks more pathetic and inept, that energy, that light is going to shift over. And I think Mamdani's principled enough to convert some of those fair weather populists into actual leftists. Not all of them, but some of them. I think he can do it in a way that Bernie Sanders couldn't, because at the end of the day, Bernie Sanders didn't win, and he couldn't deliver on his promises, because he didn't win. He's a senator, of course, but, you know, he didn't win the presidency. Mamdani won. He has the opportunity to do something that Bernie couldn't, which is show them a better way, not just through rhetoric, but in action, to be a main character, not just through an election cycle, but into perpetuity. Please keep doing stuff like this.
Pro-terrorist Marxist radicals are now the left's mainstream. We will prove that there is no problem too large for government to solve and no concern too small for it to care about. That is a direct quote from Kami Mamdani, and it should terrify every single freedom-loving American.
You guys might forget this now, but during the Biden year, I know it's easy to forget because time moves so quickly. During the Biden years, Republicans played, MAGA people, Trump supporters played with being punk rock. They were anti-establishment. Yeah, Biden and George Soros and Kamala Harris and all those people, they were the deep state. Donald Trump was the guy on the outside. He was the guy with the criminal charges. He was the guy getting arrested. He was the punk rock candidate, you know? They're the anti-establishment types. But you know what's happened over the past couple of months? Since Trump came into office, like generally, but more specifically the past couple of months, they've gone back to being the snowflakes. Now they're the whiners. How dare you vote for Jay Jones? Didn't you know he made some edgy texts? You snowflake. Kami Mamdani, boomer 2002 era Islamophobic propaganda, stuff you could see out of the Bush administration. Look at it, please. Oh, he's a communist. He's going to change things. He's going to change things. You snowflake. Yeah, you're so punk rock. Oh, I'm Bill Ackman. I'm Bill A. Pac-Man. Oh, look at my money. Oh, look at me. I'm a billionaire. I should get to decide how New York City is run. Oh, you snowflake. They're losers, man. They're perpetual losers. They won the entire government. It's like a slow burn version of how in a very, very, very short duration, all of the Zionists went from seemingly dominating the national conversation to being on the back foot. They had no ability to convince people. Zionists didn't make any effort to change minds or to win arguments. They just browbeat you.
I ain't jumping into that. This is what you call male chauvinistic bullshit. Hell no.
They just accuse you of being an anti-Semite over and over. It doesn't matter how obviously irrational or hysterical or whiny their arguments are, how meaningless and insipid or inept, like poorly delivered. You know, they just browbeat you over and over and over. Bam, bam, bam. And as people get sick and tired of being called an anti-Semite for saying they don't like it when children are vaporized by, drone missiles, the word starts to lose all meaning. So socialist has to become communist. So anti-Semite has to become Jew hater. Browbeat, browbeat, browbeat. But it's a losing strategy. Unlike Mamdani, who went from 0% to more than 50% in just a few months. He can change minds. They can't. You said anti-Semite becomes Jew hater? Yeah, they used to use the term anti-Semite.
Somehow y'all got down that road, and I ain't had no part of getting down that road. I ain't going down that road with you and nobody else.
And now a lot of them say Jew hater because anti-Semite got inevitably watered down by them using it against literally everyone who is anti-Zionist. And Jew hater sounds much more like punchy, you know? This post is the epitome of what you're saying with the right becoming the snowflakes. Yeah, I saw this. How dare you vote for Jay Jones? He wants to kill our children. Sorry, dark woke is back in. I guess Republican children are just on the menu now, huh? You whiners, you pieces of shit. You're literally, like, the Republican Party is literally staffed by neo-Nazis running on people whose entire modus operandi is we get to say what we want with no consequences. They get to go to Epstein's Island. They get to endorse, say, whatever the they want, no consequences. And now they're all whining. They're whining over everything. They're browbeating, you know? It's pussy shit. This is what I'm saying, guys. This is what I'm saying. The Republican Party's response to last night has been just as bad for them as last night was for them. You get me? I'm feeling very optimistic about the future. Yes, sir. Look at what the White House posted this morning. Again, it's difficult to remember, I guess, like, because it's insane, but this is the official White House account. Don't look at the 2025 result. Look at the 2024 result. Don't forget that. What a pathetic. Nothing signals greater defeat. Can you imagine if a professional boxer got their ass handed to them, like knocked out round 1, no hits landed, and then they posted the next day on Twitter an image of them winning the championship belt the previous year? Unbelievable. Yeah, tapping into strategic coke reserves, you know? The new gen coke barrels long since emptied. You've got the vintage coke barrels long since emptied. We had to dig through the wine cellar, the coke cellar, you know. We're pulling up like cedar aged
Absolutely. But you talking to certain men in the chat that invalidate anything black women do. So I don't do those low-level IQ conversations when they already know there's things. Don't even engage with men who disregard women that way. That's all.
Dusting the cobwebs off. This is Imperial Cope, okay? We're going back. This shit's getting a little rank. Yeah, Tsarist era Cope. What do you think the midterm playbook will look like for Republicans in the midterms? Right now, it's the Democrats' election to lose, okay? The Democrats need to learn. It's a clear lesson they need to learn from this. Like, you'd have to be an idiot or a corporate shill to not see it, okay? Listen, for one, anti-Republican. For two, genuine, earnest, anti-establishment. Or at the very least, don't be an establishment cuck. I'm not saying everyone needs to be like Bernie Sanders or Mamdani or whatever, but don't be like Schumer, you know? We know who's irrelevant in the party now. Schumer withheld his endorsement the entire time and it didn't matter. Even with Schumer's silence, Mamdani was able to get a majority. He's useless and should be excised from the party, along with everyone who's defended him. We need to be more radical than ever before. How do we keep the momentum moving after 2 weeks when this energy dies out? Buddy, I got good news for you. I got good news for you. Because we didn't just win. We didn't just come to a conclusion with the elections. Our guy got in. We have a main character now. What do you think Trump did after J6 and losing the 2020 election? He kept tweeting. We have a main character now. He can keep the energy on his own. He can single-handedly hold the ball. But he can't run for president? Doesn't matter. He is still the light countering the Republicans. In a year, we have no idea how powerful he's going to be, how influential he's going to be in the National Democratic Party. But intelligent Democrats will take advantage of his influence. Obama offered his ear so he could take credit for the win. There will be many opportunists trying to jump on the Mamdani train now that it's too late, now that it's proven, now that we know who you actually side with. But at the end of the day, Mamdani's here. He's not here to have a grudge match with the Democratic Party, okay? As satisfying as it would be for you all to watch Mamdani tweet out or give a speech on, Obama's drone strikes or whatever, that he's not here to do that. That wouldn't accomplish anything. It would be satisfying and that's it. What we need is for him to channel the goddamn spirit bomb, okay? He has to put the work in. Did Obama actually endorse Mamdani? Not explicitly, but implicitly, yes.
Chief of Policy, Stephen Miller, and Homeland Security Secretary Kristi Noem now live on military bases. They are among at least 6 senior Trump administration appointees to do so in the Washington area, leaving them both isolated from the Capitol they help govern and sheltered from political violence, but also protest. Joining us now, staff writer for The Atlantic, Tom Nichols, and staff writer for The Atlantic, Michael Schur. Michael, what's the deal with this?
Well, some of these people had moved on to bases months ago. Marco Rubio, the Secretary of State, Pete Hegseth, the Defense Secretary, I think they just like the convenience of it. Some of this is because of concerns over security threats and increased precautions that were actually taken after the Charlie Kirk assassination.
So it's just been confirmed that Stephen Miller, Pete
Officials are now moving into military bases. Here's what we know. Multiple senior officials in the Trump administration have relocated to military bases in the Washington, D.C. area amid reported concerns for their personal safety, according to The Atlantic. Top Trump advisor Stephen Miller and his family recently moved into military housing after their neighbors in Arlington, Virginia protested their presence. The Millers have since listed their home for $3.75 million. Homeland Security Secretary Kristi Noem is residing in a government-owned residence in Joint Base Anacostia Bolling, a home typically used by the Coast Guard Commander. A Department of Homeland Security spokesperson said Noem is, quote, paying fair market rent for the property. Secretary of State Marco Rubio and Defense Secretary Pete Hegseth are both living on Fort McNair's General's Row near Buzzard Point. Rubio reportedly lives there alone, while his family remains in Florida. A Defense Department official said Hegseth pays around $4,655.70 per month for his residence. Army Secretary Daniel P. Driscoll has also moved into military housing at Joint Base Meyer-Henderson Hall, which he shares with Navy Secretary John Feeling. Feeling's Washington home was damaged in a fire earlier this year, according to congressional staff familiar with the matter. National Intelligence Director Tulsi Gabbard had also considered relocating to Fort McNair earlier in the year, though the plan did not move forward due to limited space, The Atlantic reported. While it is not uncommon for some defense and national security officials to reside in military housing, experts say it is unusual for so many senior civilian leaders to do so at the same time.
A number of the members of the administration are now living on a military base. What? You didn't know this?
No.
Oh, yeah. Stephen Miller just moved there. Kristi Noem lives on a military base. J.D. Vance. Oh, no. Rubio. Pete Hegseth. I mean, for people who love America so much, they seem to be scared of it.
I'm one of those people they call a conspiracy theorist. When I hear things like that, I'm like, what do they know that I don't know?
Well, I don't think it's I don't think it's, it's in the paper, but I don't know.
What's up, guys? D7 back at you. As always, a lot going on out there, but we've got some moves being made here that I wanted to point out that we haven't seen at this level before. We've got multiple Trump administration officials, high-level officials, high positions, trying to move on to military bases. Many of them are making this move right now. Some already have. Others are trying. Now, Army Secretary Dan Driscoll, he's trying to make this move. Kristi Noem was one of the first to do this. We also have now Stephen Miller packing his family up and moving into the area in D.C. known as General's Row or around that vicinity. You have Marco Rubio that lives on the base as well. You have Pete Hegseth. Then you have Tulsi Gabbard trying to get on to the base to live with her family. All because they fear for their lives. They're saying that they fear the repercussions of what is to come with protests, with riots, assassination attempts, all this stuff. And then there's more that they will not name because of national security and to keep them safe. They will not name these individuals. So we don't even know who they are that they're moving into the base because they all fear for their lives. So we've seen a lot of action, a lot of protests over the years. BLM, we've seen all kinds of crap.
But my whole thing is, we've seen all of this stuff over the years. When did people start moving on to military bases? Did we have people living on military bases when Obama became president? Did we have anybody living on military bases when Biden was president? Why is it that now we need people moving on to military bases? What's going on?
We've never seen officials start to flip out and geek out like this and go running for cover into the military bases. It's as if they're expecting something huge to happen. I think we can all feel it in the air. The question is what, when? It could be a combination of things, but one thing's for sure at this point. They're telegraphing that they know something huge is coming that's going to make the people upset en masse. And they're basically running into hiding, into a protective space here. And I expect more to follow. If I get names on these individuals they're trying to keep under wraps, I'll update. I'll let you guys know. Make sure to follow me on X as well. And join me for the live streams Monday, Wednesday, and Friday, where I got more time to talk about this in greater detail. Hope to see you guys there. Much love.
These Trump goons are stealing homes from the military. Stephen Miller, Marco Rubio, Kristi Noem, and other top Trump regime members are moving into homes meant for senior military officers. Houses that are reserved for the people who defend this country, and who aren't actively tearing it to the ground. Noem was even living in one of these homes for free earlier this year at Joint Base Anacostia Bowling. She cited security concerns after her apartment was published by a tabloid, though no credible threats were identified. Miller and his wife Katie left their home in Arlington after activists were protesting outside of it. Rubio moved on to General's Row at Fort McNair and the Millers joined him. Defense Secretary Pete Hegseth also moved into military housing, paying a little over $4,600 a month after $137,000 in renovations. Military housing in Washington, D.C. is limited, and ordinary service members and their families are stuck in houses with mold, lead paint, and unsafe conditions. Meanwhile, these political officials live in fully renovated homes, some upgraded with tens of thousands of dollars of emergency repairs. Money that could have gone to troops instead. These moves have caused tension between political appointees and top commanders, who see their housing being taken over while the men and women who serve this country are still stuck in substandard conditions. While military families struggle, political con men take over the safest homes in the city. Legal? Maybe. Fair? Absolutely not. But this is what the Trump regime is all about. They're going to take what doesn't belong to them, and there's nothing you can do about it to stop them.
Some major exclusive news breaking right now that you need to hear. The Atlantic is reporting that a significant number of senior Trump administration officials are living in military housing. This is causing a major issue, as they are reportedly taking up limited housing spaces that are designated for senior military leaders. According to the report, the military is now literally running out of housing for its own personnel because of this influx. So who is involved? The report specifically names senior official Stephen Miller and Senator Marco Rubio as occupants. It was previously known that Christine O'Malley was also living in these military installations, but this new report suggests the scale is far larger than anticipated. And the reason why this is happening? The Atlantic reports that these officials are fearful of protests and are seeking refuge in these secure locations. This situation is being called completely unprecedented. Sources cited in the article state that there is no record of so many political appointees ever moving into military installations like this. The situation has become so concentrated that, according to the Atlantic, The area is now being dubbed the, quote, unofficial green zone because of the number of Trump officials living there. And the final question, who is paying for this? You are, the taxpayers.
When
Spread
top
the word.
officials start relocating to military bases, it's never just routine. It's a signal that something serious is brewing. Sources close to the Trump administration reveal that several top figures, including Secretary of State Marco Rubio and Secretary of Homeland Security Kristi Noem, have quietly moved to undisclosed military bases. Reports suggest they're not only seeking safety, but also coordinating emergency measures with top military commanders. Officially, the explanation is civil unrest, but multiple insiders claim the situation is far more complex. Heightened military readiness, restricted flight zones, and sudden communications blackouts hint that the government is preparing for a national-level crisis. Some even believe this could be tied to internal threats, cyber attacks, or fears of an external strike. The silence from the White House has only deepened public concern. As tension grows, Washington is on edge. Security around major cities has visibly increased, and military convoys have been spotted moving through key transport routes. Analysts warn that when leaders move to bases, it usually means the government is entering crisis mode, and whatever's coming next may soon affect the entire nation.
You know that top Trump officials are now living on U.S. military bases? Yeah, civilian advisors living on U.S. United States military bases. They moved out of their Washington, D.C. homes to live on military bases. Why, you're probably asking? Let's break this all down. It all started after the assassination of Charlie Kirk. And soon after that, protesters started targeting the White House advisor, Stephen Miller, and his wife, Katie. Protesters then got outside his neighborhood in Virginia, said that he was like one of the mustache people. And now the Millers, alongside with at least 6 other top Trump officials, are quietly moving into secure military housing across Washington, D.C. These people include Kristi Noem, Marco Rubio, Pete Hegseth, and others. And these houses are usually reserved for generals, and so they were pushed out to put in these political appointees, and experts say that this is like the first time we've ever seen something like this. But
I bet you it's more than one person that got threatened. That's what happened. More than one person got threatened, and then they all decided collectively they finna move somewhere to housing.
The reason for all this is quite clear. The threats are escalating because after Charlie Kirk's death, we've seen the Trump administration label Antifa a domestic terrorist group, despite no legal framework on that label. And with ICE agents going through cities, with the National Guard going and being put into cities, and other things happening, including, well, a government shutdown, people losing SNAP benefits, people are getting angry of the people who are making the decisions. And look, in history, we have seen sometimes these figures go into these bases for a temporary thing, but now it looks permanent, which should show you something. That if your people are that angry with you, that you have to live full-time at a military base, clearly you're doing something wrong. And there's more to this story. The Atlantic put out a great article called "The Top Trump Military Officials Are Moving into Military Bases," and I would suggest you read it. It is quite interesting. I'll be sure to keep you guys updated on this, though, so please do share my videos and follow me for more.
That is wild.
Now, The Atlantic is exclusively reporting that senior Trump administration officials are living on military housing, taking up housing from senior military leaders, and they're literally running out of housing because Trump administration officials, from Stephen Miller to Marco Rubio to others, are living on military housing, and it's unprecedented. There has never been so many administration officials living in these military housing, and the reason why is because they're fearful from protests and more. Previously, we knew that Kristi Noem was living in these military housing installations, but now Stephen Miller is, Marco Rubio is as well. There's no record of ever so many political appointees living in these military installations. It's literally being dubbed the, quote, unofficial green zone, according to The Atlantic, because of how many Trump officials there are living there. And you know who's paying for it? You, taxpayers. Spread the word, read the full article on The Atlantic's website, follow along, stay up to date on all the news that you need to know about, and we'll have much more.
At college campuses all around the country are setting records for attendance. You have hundreds of thousands of new young people weekly coming into the movement that are enthusiastic, young conservatives who are looking for truth, who believe in America's founding principles, and who want to be engaged. And they will be engaged in next year's midterms. The third reason is we got a very favorable map. You shouldn't miss this either. I was very bullish even before the current redistricting battles began. As we sit here today, there are 13 House Democrats sitting in districts that President Trump won. There's another 21 of them in districts he came within 5 points of winning. There's only 3, conversely, there's only 3 House Republicans sitting in districts that Kamala Harris won. That's a lopsided map. And after redistricting, we think we'll net a few more seats, handful, maybe 6 to 8. We're in very good position to make history and grow this majority. And finally, I'll just leave you with this. The reason we're so enthusiastic about running next year is we have a real record to run on. Mondami and Democrats want to talk about affordability. We love that subject. We love it. Look at the facts. I brought some this morning. It's the Republicans who are working every day to make life more affordable for working families. And it's not a talking point for us. We are delivering. After 4 long years of skyrocketing prices under the Biden administration, we had to take over. You don't flip a switch and reverse that overnight. It takes a while to work those policies out of the system and to get the new ones in. President Trump and Republicans are delivering results for the American people that they can see and feel. To date, we've seen core inflation is nearing its lowest level in 4 years. Gas prices have fallen to a 4-year low. Prices for everyday goods continue to decline, and blue-collar workers are seeing the largest increase in wage growth in nearly 6 decades. That's the result of our policies. In Congress, House Republicans are working hand in hand with President Trump to advance his affordability agenda. It is President Trump who ran on that. It's President Trump who's delivering on that. And we are all partners in that new effort to make America great again. It begins with the economy, and we know that. We're laser focused on making a difference in the lives of hardworking American families. Here's another demonstration, the Working Families Tax Cut. It is aptly named. It's the largest tax cut in U.S. history for working and middle-class Americans. You got Bernie Sanders running around. They're talking about the billionaires. It's not this. That's the opposite of the truth. Look at the facts. That bill was written for lower and middle-class earners, and they're the ones that will feel the positive effects going into next year. We included in that, as you know, no tax on tips, no tax on overtime, real tax relief for seniors. These are the kinds of things that people feel, and they see that we're making good on our promises. We've made historic investments in American energy dominance to drive down the cost of gasoline and groceries. And we're grounding every decision we make in common sense. That's what we restored. That's what we ran on. That's what we're delivering. A return to common sense, not the woke progressive nonsense that they delivered for 4 years, not the spending like drunken sailors that drove cost up for everything with inflation. We're restoring common sense, fiscal responsibility. We're good stewards of taxpayer dollars, and we're refusing to cave right now today to the Democrats' wild demand to spend $1.5 trillion in new spending. That is taxpayer dollars, that's your money, that they want to spend to reopen the government. That's their counterproposal. That's why we're not having a negotiation with them. It's ridiculous. Included in the $1.5 trillion that they want to spend is $200 billion, almost $200 billion to restore health care benefits to illegal aliens. That is taxpayer money that they want to spend for that. They want to send billions of dollars back overseas for social programs in foreign countries. We're not doing that. They want to give $500 million back to the Corporation for Public Broadcasting to prop up left-leaning news organizations. We're not doing that. And by the way, in the middle of all this, they want to cut $50 billion from the Rural Hospital Fund. They can't tell you they care about health care since they put that in their proposal. We're grounding every decision in common sense. And Democrats had their chance. When they controlled Washington, look at the history. Don't forget it. This was just a year ago. You know what we inherited? They left us with a 40-year high inflation, higher taxes and energy prices, and massive instability around the world. And what did they do in June of this year? This is the most recent history no one can forget. They voted against no tax on tips. They voted against no taxes on Social Security. They voted against a larger child tax credit. The Democrats in the House and Senate voted against lower energy prices, against more American manufacturing and jobs, and against lowering health care premiums by 12%. That provision, the cost sharing reduction provision, was in the House version of the Working Families Tax Cut, the big, beautiful bill. We sent it over to the Senate, and they worked to strike it out of the bill. Ask the Senate Democrats about that. Right now, they've created another mess. They've created a mess for America with this pointless government shutdown. The Democrats will tell you that they're feeling emboldened they're feeling emboldened because they had a few blue state election results, it does not change the fact that they have walked their party off a cliff with no parachute and no path forward. The reason we're stuck right now is because of one simple fact. If they vote to reopen the government, the Senate Democrats are afraid that the radicals in their party will say that they caved. They're afraid of the retribution that will come from that. But if they keep the government shut down, they know very well, as we all do, that millions of Americans will continue to suffer as essential services remain unfunded and paychecks to federal workers continue to stay stalled. So our question for Democrats this morning is this: which constituency matters more? The loud radicals in your party or the hardworking American people? I can tell you which side the Republicans are on. 15 times we voted for the hardworking American people. And 15 times so far, the Democrats in Congress have voted for the radicals in their party. It is unconscionable to us that they've allowed it to go on this long. And at some point, all you can do is pray that common sense prevails. And that's what I've been doing a lot of. We hope and pray that there are still Democrats out there. There's just a handful. We need 5 more votes. 5 centrist, common sense Democrats in the Senate to come to those senses and do the right thing. It's time for them to put their country first. I'm delighted to introduce the next speaker, and he's a congressman from Miami. He's a former mayor of the county down there, and he has been in charge. He served as a police officer, but he was the chief of the fire department down there. I mean, the guy's resume is longer than almost anybody in Congress, and as a son of a firefighter, I always take personal delight in reminding everybody he's the only career firefighter paramedic in Congress. He's doing a great job, and he serves as vice chairman of the Republican Governance Group, one of our largest and most active caucuses I mentioned, and we're truly grateful to have him here to discuss some of these consequences of the government shutdown. Glad to have you. Carlos, come on up.
Thank you.
Thank you, brother.
Thank you, Mr. Speaker. And if you indulge me, I think you brought me up here to talk about the shutdown, but I will stray a little bit. I'm the only Cuban-born member of Congress. That means I was born in Cuba. I was not born here in the United States. I didn't speak a word of English until I got here. I was 7 years old. And the reason I'm here is that my parents brought me here seeking freedom. Freedom from communism, freedom from a Marxist regime. And so I can tell you that I know a communist and a Marxist when I see one. They may call themselves socialists, they may call themselves a democratic socialist, but make no mistake, Mondami in New York, he's a Marxist. And the thing that bothers me is he's very proud to say, well, I'm young, I'm this, I'm that, I'm Muslim. I understand you can be proud of that. But then, if you're so proud, don't call yourself a democratic socialist. You are a Marxist. Go ahead. Tell people exactly who you are. He couldn't, and he can't because he knew he wouldn't get elected. But I hope that the people of New York do not suffer the same consequences that my homeland of Cuba has suffered. Castro and the Castro regime destroyed my homeland. They can't even keep the lights on. They don't have food, they don't have medicine, they can't keep the lights on. It's a total disaster of an island, a beautiful island that actually had the second highest standard of living in the Western Hemisphere when the regime took over. And so one of the reasons I'm in Congress, the primary reason I'm in Congress, is that I want to make sure that my children and grandchildren never suffer the same fate that my parents did, having to leave their country and bring us to a new country with about $10 in their pocket. Now, that's what makes this country great. My parents came here with $10 in their pocket and a watch. By the way, I still have that watch. All right. And here I am. Their son was a firefighter. He was a city manager. He was a county commissioner, county mayor of the largest county in the state of Florida, and now a member of Congress. I don't think there's too many countries that you can say that can happen. That's why I love this country. That's why I will fight for this country. And again, I know a Marxist when I see one. And it's unfortunate that the Democrat Party is heading that way, which means we just have to fight that much harder. Here to talk about the shutdown. And so, I'm Congressman Carlos Jimenez again. I represent the state of Florida. Miami and the Keys. Today I'm standing in for my friend, RG2 Chairman David Valadao of California, with one clear message, and I want to thank also the other members of RG2 that are here. The Republican Governance Group focus has always been about governing responsibly. RG2 is committed to putting results ahead of rhetoric, keeping the government functioning, and finding practical, common sense solutions that improve the lives of the American people. That's what we're here to do. And that means that we do what's right, even when it's hard. Yes, we're here on day 37 of the Democrat government shutdown, and with each passing day, more Americans are feeling the impact. The effects in my hometown or in my state. In my home state of Florida, 155,000 federal employees have not received their paychecks. Close to 2 million Floridians who rely on SNAP, including more than 1 million children, will not be getting their benefits. My colleagues on the other side insist we have chosen, my colleagues on the other side of the aisle have chosen politics over food security for millions of Americans. Small business loans are being delayed, totaling nearly $300 million in missed distributions, costing our state a estimated $1.7 billion in economic benefit alone. Starting Friday, 10% of the American airspace is going to be reduced because of the shutdowns ahead of the busy holiday season. More than 3,500 flights will either be delayed or canceled altogether. That's true effect of this shutdown. Let me be clear, holding the government hostage is not a responsible way to negotiate policy. On September 19th, the House of Representatives voted to extend government funding to keep the government open. And as the Speaker said, with a clean CR. There were no riders in it. There's no policy differences. It's actually a Biden budget, right? And so, you know, what is the problem? No, there is no problem. It's politics. That's the problem. Meanwhile, Senate Democrats have voted 14, now you say 15 times to keep the government closed. The funding bill before the Senate is the same short-term continuing resolution that we passed 15 times under President Biden with bipartisan support. And I supported each and every one of them to keep the government open. And I know that most, if not all, the members of RG2 also voted for the CRs to keep the government funded. We can and should debate serious issues like healthcare costs, but not at the expense of hardworking American families. I urge my Senate Democrat colleagues to pass the continuing resolution so that we can reopen the government and return to the table to negotiate real solutions. History shows that when Congress works together, we can find solutions without inflicting pain on the American people. I urge Senate Democrats again to reopen the government, end the suffering, and then join us in crafting meaningful bipartisan policy meant to improve the lives of everyday Americans. That's how we govern responsibly, and that's how we serve the American people. And I want to thank you for giving me the opportunity. And I guess now I want to turn the dais over to our Majority Leader, Steve Scalise.
Well, thank you, Carlos. And what an honor it is to follow my dear friend, Carlos Gimenez, who really is the epitome of the American dream. You know, when you hear stories like his, sad stories, the root of it, having to flee your home country because Cuba fell to Marxism, to communism. But luckily, for people like Carlos, all around the world, there's one place that they can look to if they want a North Star. If they still believe in freedom, they yearn for that desire, and then it fails in their home country, they can look to the United States because the United States represents freedom all around the world. And how dangerous of a position that is when Marxists from within try to change it here, try to unravel what makes America so great. And as Carlos came to seek that freedom that millions others have as well, like my great-grandparents who came from Italy to seek that same freedom. Ronald Reagan said it best: freedom is only one generation away from extinction if we don't fight to defend it. Those words of Reagan still ring true today. Because, Carlos, we will continue to fight for freedom. But it's not an empty fight. There are people on the other side here in America that are pushing back, that want to destroy that capitalist free market system. And so when you look at the results of the election, anybody that wants to go celebrate a blue state voting blue, what they're not acknowledging is what happened in a city like New York. It reverberates. When New York elects a Marxist as their mayor, there are other Democrats that are now looking and saying, does the Democrat Party represent me anymore? And today you heard it again. Democrats are the ones who are looking and saying that they're done with the Democrat Party. Jared Golden yesterday announced he's not going to run again. And he didn't just say he wasn't going to run again because he got tired of serving in Congress. I think it's really important to pay attention to what Jared Golden said. And he is in a swing district. Jared Golden is one of those moderate Democrats who represents maybe the old Democrat Party now, what was discarded by the voters on Democrat cities and states. But it's not where America is. So when Jared Golden announced yesterday he's not going to run again, he said, quote, "We're allowing the most extreme pugilistic elements of our party to call the shots. Just look again at the shutdown. For as long as I can remember, we have opposed shutting down the government over policy disputes. We criticized Republicans for taking hostages this way." That was Jared Golden explaining why he's done with being a Democrat in Congress. And when the Democrat Party no longer stands for common sense, for members that do on occasion reach across the aisle, they're going to be relegated to a scrap heap of history, because America is not a socialist nation. While the Democrat Party has turned their leadership structure over to a socialist, it's not where America is. And if they're running people like Jared Golden out of their party, they can go celebrate the results of last night's election. Again, if Alabama held an election also Tuesday, and gee whiz, a Republican governor was elected governor of Alabama, would anybody be writing a story about it? Of course not. So let them go celebrate New Jersey electing a Democrat governor, New York City electing a Democrat. The real concern is that the Cuomo wing of the Democrat Party got destroyed by the Mamdani wing of the Democrat Party. And if they want to call that a victory, good luck. Something tells me they're not going to be sending Mamdani to swing districts around America. He's not going to Maine. Let Mamdani go to Maine for that now open seat in Congress, a 50-50 district. Will they be sending Mamdani to those kind of swing districts? Colorado, where somebody like Gabe Evans represents, is Mamdani going to be going there? Because that's where their party is now headed. And they chose that. But America is not embracing that form of socialism. We know what you get from socialism. You get the promises of free everything. But Americans know innately there's no such thing as a free lunch. All you end up with, the results, are the hollow promises and the failures that come with those promises, because you know you get what you pay for. And somebody else is going to have to pay for that free thing. And a lot of those rich people they love denouncing are leaving. Many have already left. So even when they go raise taxes even more with the highest rates you can imagine, who's going to pay those higher rates? It's not going to be the millionaires and billionaires. Many of them have already left. It's going to be hardworking families in New York City. Good news for you, you might be making $100,000 a year. By the way, a police officer married to a school teacher makes more than that in New York City. They're going to be the quote unquote rich who get the higher taxes and the free buses and the grocery stores that are run by the government with empty shelves and expired food. That's what they're going to get. But the rest of America is not going to have it. So while Democrats keep the government shut down, and they brag about it, I mean, you heard Senator Murphy yesterday, quote, "I think we're in an enormously strong position right now." Strong position? What's so strong about taking food out of the mouths of 42 American families? What is strong about that, Senator? Sure, you can vote again today to keep the government shut down, but there's nothing strong about denying food to people who are low income and who can't afford it. That's a weak place to be. But that's what they're bragging about. When, as we saw, the transportation secretary yesterday said 10% of flights are going to have to be cut back because we don't have enough air traffic controllers because Democrats chose not to pay them. And so people are getting ready to go travel to see their family, hopefully, for Thanksgiving. But they're not going to be able to get that flight. They're going to have to leave a day or two earlier to drive. Maybe they won't be able to fly. But don't worry. Some Democrat senator thinks he's in a stronger position because he's now leveraged Americans as pawns in some game. That's what they think this is. It's disgusting. And the American people are catching on. And so while Democrats applaud socialism being the new wave of their party, the few common sense Democrats left in their party are leaving, running for the exits. Well, you might be able to leave New York City and go to Florida or Texas or somewhere else, but if they destroy America, there's nowhere else to go. That's why we're going to fight for freedom every single day, and their approach to Marxism, socialism, whatever you want to call it, will not prevail in America. Our whip, Tom Emmer.
It's day 37 of the Democrat government shutdown, and one thing has become clearer, more clear now than ever. The Democrat Party of today is not your grandparents' Democrat Party. They refuse to govern. They resort to hostage taking when they don't get their way. They routinely put politics before people. And now they have made communists and assassination fantasizers the pillars of their party. Democrats claim they want to make life more affordable for hardworking Americans, but every time that they've had the majorities in Congress and a Democrat president in the White House, they've done the exact opposite. Take the American Rescue Plan under Joe Biden, for example, which was later deemed by economic experts as the, quote, original sin that led to double-digit inflation. Or look at the Affordable Care Act, which is so unaffordable, they have to pay people to use it. The Democrats have no moral high ground to stand on when it comes to good governance. They don't know what it is. And when they claim that they're fighting for you, do not believe them. Because if this shutdown has taught us anything, it's that the Democrats will willingly inflict pain on the American people if they think it gives them political leverage. Their kamikaze politicians and their constituents deserve better. In stark contrast, however, Republicans have done our jobs. We passed a nonpartisan government funding bill out of the House over a month ago. All we need, as the Speaker said earlier, is just 5 Democrats in the Senate to grow a spine, stand up to the radicals in their party, and join us in getting our clean CR to the president's desk. Enough is enough. It's past time for Democrats to end the political games and reopen the government for the people they were elected to serve. Our conference chair, Lisa McClain.
Thank you. Well, good morning, everybody. Again, here we are. Yesterday, Americans woke up to an unthinkable reality. And Carlos touched on it earlier. A communist was elected mayor in America's largest city. How did this happen? Ask yourself, how did this happen? It happened because a small socialist portion of this country took control of the Democrat Party. a party that is now apparently united behind a socialist agenda. And slogans always seem to start with the same word: free. Free food, free rent, free buses, right? I feel like I'm at an Oprah Winfrey show. You get a car and you get a car.
Why they always come on here and pretend like they are so helpless against the Democratic Party? The Democratic Party does this, the Democratic Party does that. Republicans don't want nobody to have health care. That's why they aren't going to negotiate. This is a Republican breakdown. This is their shutdown. Trump even wanted them to negotiate. They just don't want to because they don't want nobody to have health care. They already cut you off. They do not care about American citizens.
Well, this isn't the Oprah Winfrey show. And like many of you, my parents taught me a really good lesson when I was young. Nothing is free.
You notice that every last one of them came up there and said something goofy. This Democrat, Socialist, Marxist, Democrat, Socialist, Antifa, BLM, everything to distract people, to get people to remember all those weird names and numbers.
Everything comes with a cost. Absolutely nothing is free. We all learned that. Look no further than the Democrats' disastrous shutdown plan. They want to give free health care to illegals. Come to our country. We'll give you, illegally mind you, we'll give you free health care on the backs of hard-working Americans. And in demanding that, they're asking for $1.5 trillion in wasteful spending and a painful shutdown. A shutdown that has denied food assistance to 42 million American families. 42 million American families. A shutdown that has forced law enforcement to work without pay. But don't worry, I'm sure those law enforcement agents can go and get free food from their local grocery store, and somebody will pay their free rent, right? Yeah, I live in reality, not fantasy. The Democrats want to jeopardize our national security. And now?
It's never what they do wrong. It's always the Democrat does something wrong. It's always the Democrat that don't know how to govern. And it always happens on Republican watch. It always happens because a Republican doesn't want to do what they need to do. It's always the Democrats' fault. This is wild. Remember, the Democrats have only the Democrat. What do you mean? Trump let it go down the last time. Trump is the one that is the problem. That's what y'all don't get. Trump is the problem.
Flights have been reduced by 10% at 40 of our major airports. I think air traffic, like when you get on a plane, what's next? Like your plane rides are going to be free too? I mean, why stop at food?
How is it that it's Democrats' fault and Democrats want to give people Medicare, but the Republicans don't? But they don't mind giving the money to the rich. Make that shit make sense. You gave all that money to the rich, but you don't want to give anything to the poor. Make that shit make sense.
Food and buses. Let's just give everything free. It doesn't work like that, people. Nothing's free. Somebody is paying. And who pays? Anybody want to guess who pays? Hardworking taxpayers. American.
Hardworking taxpayers pay for the rich people to get the cuts. Now you want us all to be mad because the poor people want to get medical. Why we got to get mad at the poor people who need medical, but we shouldn't get mad at the rich people who wanted rich tax cuts? Make it make sense.
And taxpayers. That's who pay. Nothing's free, right? Nothing is free. Look at your Republican leaders. Just compare and contrast. That's why we voted more than a month ago to actually fund the government. That's why we've been working in our districts to help those that are suffering.
How did you help the rich people? Why you can't help the poor people? You helped all the rich people. Why can't you help the poor people?
And that's why we are delivering real results that drive down gas prices and drive down mortgage rates and drive down the price of eggs. No one's reporting on the price of eggs anymore, right? Now, not for illegals, not for radicals, and not for communists who despise this country, but for the men and women who love America, like Carlos and his family who came over. And let's keep it that way. And let's make sure that we keep America strong every day.
Every day we give money to rich people. Why you can't give them health care?
So to the Democrats, let me be clear. Republicans will still be there when your communist lawmakers aren't.
Didn't y'all hear the word? Didn't y'all hear the word communist? Marxist, socialist, y'all hear all that. This is what the people got tired of hearing. All of this name calling, all of this rhetoric that we keep hearing, all of the things that we keep hearing from. That's all they can say. Every person that has stood up in front of the camera has said something wild about Marxists, socialists, because this is what the Republicans do. They don't care about regular, ordinary, everyday Americans. They only care about the rich. And anybody on here defending a Republican, you suck dick.
And when your communist kingmakers finally give you permission to put Americans first again, Republicans will still be here. We'll still be here when your socialist experiment collapses, because it always does. And we'll still be standing shoulder to shoulder with the hardworking Americans who aren't demanding free groceries, free.
You notice how every Republican in the chat is the zombie who comes up with excuses for the rich getting money. They hold the nuts of the rich. Everybody in here who's a Republican maggot, they want to deal and give the money to the rich. How you in here caping for rich people? You was dumb enough to give your money to rich men. Dumb people gave money to rich man so the rich man could give it to other rich men. Just dumb.
Free buses, free rent. No, we will be standing shoulder to shoulder, demanding nothing less than freedom. That is what Republicans demand, freedom. Because that's what makes this country great. Not socialism, not government control, but freedom. Thank you.
They caping for rich people. That's what the Republicans do. They cape for rich people only. Sure did. Sure did.
All right.
They want to cape for the rich people. And there's Republicans in the chat caping for rich people. And they the ones who get food stamps. Make it make sense. Y'all the party of people who get food stamps, and y'all caping for rich people.
Any questions? Yeah, go ahead. Go ahead.
The Supreme Court, and specifically Justice Gorsuch yesterday, seemed concerned about the Trump administration's usurping congressional authority, calling it a quote, one-way ratchet that can't be turned back. What's your response to that? Are the justices right to be concerned that Congress is fulfilling its constitutional obligations?
I don't find myself in disagreement with Justice Gorsuch too often, but I think he's missed the mark on this one. First of all, I don't think you should read too much into the questioning that you heard at the Supreme Court. I mean, this is part of judicial review. It's a cherished part of that tradition. I used to be one of those litigators. I did constitutional law, oral argument, and I would have liked to have argued that case yesterday, because I think the law is clearly on the side of what the administration has done. I'll remind you that I'm a jealous guardian of Article 1. You know, the legislative branch of government in our constitutional system is the most important. It was placed first.
Thing is how you're one of the rich guys, rich white guy, wealthy white guy. When are you going to be passing on the savings to the poor people? When are you going to start saving money and giving it to the poor people? When does that start to happen? When y'all laying off everybody and their mama? When do the American people start getting some of that tax cuts you get taxes from? That money.
In prominence, and that's true. And while Congress has a role to play in tariffs and related trade and economic policy,
Well, you need to get the hell on whatever for. You're the zombie. Get out. Zombies, get out. Styles, whatever for. Get out, zombies. Zombies only walk forward with their mouth open. That's what zombies do.
the executive branch does as well. And I think the president has used that well within the bounds of what he's allowed to do, because he's addressing what was truly a crisis for the country. The trade disparity had gone on for decades. It was creating a real imbalance, and it was adversely affecting American people and consumers. Remember that he ran on this idea. He talked about tariffs on the campaign trail, and he got a popular and electoral college mandate in the election. So this is not some surprise.
I don't think we can hear you, wealthy white guy. We can sure read, though.
He's fulfilling the promise that he was elected to fulfill in a literal sense. So I think the court has to give deference to that. I think the court has to recognize the executive is doing what they're doing. He's using tariffs to create leverage in our trade strategy, and it is yielding great results for the American people. And heaven forbid if it were reversed, because it would create chaos.
Unfortunately for you, wealthy white guy, we're winning in every category. Unfortunately for you, that's not a part of what you all do. You all just cape for other rich white men. You gave your money to a rich dummy, and that rich dummy, your orange thug, gave your money to other rich dummies. Wow.
Which is one of the questions I think Justice Barrett asked, my old friend from Louisiana. I mean, that was an important question, because it would set back all of the strategy and the trade agreements and a lot of the things that have been accomplished for the people. So in summary, I would say, don't read too much into the questions. This is how the process works. I'm sure the court will look at this very carefully and deliberately, as they do, and I expect that we'll have a majority of the court.
I don't expect people who don't know how to read elections to understand the significance of yesterday. I can't explain it to you dummies. Zombies don't understand what I say anyway. So why would I explain to you what the significance of winning all of the states yesterday? Why don't you go back and read what they wrote, what they won? Zombies don't understand me anyway. We're just going to continue to laugh until next year.
It says that this administration is doing what they have the legal authority to do. If I felt like the executive branch...
Morons can't explain why they over here caping for rich billionaires. Why are the maggots over here caping for rich people? Why are they on their knees for rich people? What is going on?
Branch had overstepped its bounds on trade or on the tariffs or something.
Tony, you're an idiot. If you don't understand the tax cuts, you don't understand all the contracts, you don't understand any of that stuff that they gave to the rich people this summer, then you're a moron on top of being a zombie.
I would have stepped in. I mean, that's my job as the Speaker of the House over the legislative branch. I would have done it in my own way, to be candid. I would have gone to the president privately and said, hey, sir, enough. I think you're overstepped the bounds. Let's try to figure that out. I wouldn't have publicly had a big spat with him because it wouldn't have been necessary. But that conversation didn't happen because I believe that what he's done is well within the bounds. And so we'll see what the court does. Yes.
Thanks, Mr. Speaker. Leader Thune has said on a number of occasions that in exchange for reopening the government,
these people are over here caping for rich people. These maggots are over here caping for rich people. Y'all look at it. Democrats, look at this shit. These maggots are over here defending rich people, and they ain't even rich. That's wild. Maggots over here caping for rich people, and they ain't even rich. Why would you be a poor person caping for rich people? That's wild. That's wild.
he will promise Democrats a vote on ACA subsidies by a date certain. Will you do the same now?
He promised it a long time ago, and he was rebuffed. I mean, that's not what this is about.
Make sure you look at Tuesday night's elections. That's going to be apropos for you guys. Every election from here on out it's going to be just that way. Just that way. The poor maggots are over here caping for rich people. That's wild.
About. I mean, they've demonstrated over and over and over. Somebody said this is the Seinfeld shutdown. It's about nothing. If you brought in 100 Senate and House Democrats right now and said, what is it about? They wouldn't even give you the same answer. They don't even know. They filed a counter proposal that's $1.5 trillion in new spending with all the crazy abuses that I listed earlier today.
Sure, wealthy white guy. Yeah, sure. There's all kinds of fraud, like your retard orange thug. There's all kinds of fraud. We get it. Y'all look at these maggots over here caping for rich people. I bet you half the people in this chat make less than $150K, and they on here caping for rich men. Poor trash caping for rich men. That's wild.
That's still sitting out there. That's the counter proposal. Then they tried to say it was about health care. That was never the issue.
You don't work for tits either, dumb Tony. Zombie? What the hell are you talking about?
For the September 30th fiscal cliff. That was always a December issue. We always knew, everybody in the building knew, we were going to have to wrestle through that and come to a consensus on a solution on the COVID-era Obamacare subsidies.
Shut your ass up, wealthy white guy. Shut your ass up.
In October, November, December.
Most of the maggots make less than 150K, and they on here caping for rich people. That's wild. That is wild. Caping. They got their cape on, their heels, they flying suit. They got everything on here caping for rich people. Go ahead on, y'all. Give my money. Poor people gave their money to a rich idiot called Donald Trump, and Donald Trump gave their money to the poor, to the rich. That's wild. Poor people gave their money to a rich man who scammed them out of the money and gave it to his rich friends. That's wild.
And ironically, they're eating up all the clock where that would have been done.
Tony. Stop it. You ain't dumb. Stop it.
It's not about any of this. It's about politics, as we explained.
No, the only thing I call you is I'll call you all zombies and maggots. That's what you are.
Earlier, they are more afraid of the radical activists who are running the Democratic Party right now than they are of starving families, having families go hungry and having federal workers go without paychecks. That's just a simple fact. So yes, Leader Thune has been over backwards. He's offered them a vote. You know what they told him in response?
Get the hell on, Tony Tigress. You're too dumb to understand what you just did when you voted for Donald Trump. If you're too dumb to understand what you just did, you shouldn't even be over here. Because you're a zombie, and zombies don't do nothing but walk forward with their mouth open. You're a zombie, Tony. Get the hell on and go to one of your zombie channels.
No, we need you to guarantee the outcome of that vote. Well, that's ridiculous. That can't be done.
From the Senate, will you assure the House members will get a vote? House Democrats will get a vote on ACA subsidies by date certain?
No, because we did our job, and I'm not part of the negotiation. The House did its job.
Really? No tax on overtime? That's the only thing they can point to. All of those subsidies, all of those tax cuts, all that money they just gave away to all of those rich people, all those contracts, and then Tony the Tiger gonna come in here and say, oh, they gave us tax on overtime. They gave us tax on overtime. No tax on overtime. Poor people are in the chat caping for rich people. Make it make sense. Make it make sense to me. Zombies. Make it make sense. Caping for rich people.
On September 19th, I'm not promising anybody anything. I'm going to let this process play out. I'll tell you what they wanted. I'll tell you what Schumer and Jeffries wanted. In fact, Chuck Schumer said it publicly and decried that Thune and I would not go in a back room with them and make a four corners agreement on
Sure I am, Melissa. Sure I am. But you're caping for rich people, poor as dirt, and caping for rich people.
Obamacare subsidies. And I said, there's no way. That it was never possible or appropriate for that to be handled on a CR, on a short-term stopgap funding measure. And he knows that. And we're not doing that anymore. We're not taking four corners, four leaders in a back room and making a deal and hoisting it upon the people. I'm not going to be a part of that. Chuck Schumer is part of the old way this was done. And that's part of the reason why people have such a lack of...
Ain't nobody hiring nobody, Black America. They've been laying people off. What are you talking about? Don't turn into no zombie. What are you talking about? Ain't nobody hiring nobody. Don't you come in here caping for no rich people. Don't come in here caping for rich people. That's wild.
Trust in Congress. We need to be transparent, open. We need to do it through the process. We need to involve and engage all of our caucuses and all of our members in this discussion. Healthcare is very complicated. It is very complex, and it is not something poor people can go in a smoke-filled room in the back.
I understand exactly what it means, retard, wealthy, white guy.
And make a deal on. I reject it. Yes.
I understand you on here caping for rich people. That's what I know you doing. Damn, how many MAGAs I got in here? Zombies galore. Nothing but zombies. Zombies that don't have no sense. Zombies don't know when to quit. Zombies that are caping for rich people. Zombies are saying, oh my God, give the rich people money. Let's talk about Keisha buying a steak. I'm mad that Keisha buying a steak. I'm mad at Keisha buying a steak, but I don't give a damn that our president just gave away $40 billion to Argentina. I'm a cake for that rich dude giving my money away to somebody else. Wow. Wow. Caping for rich folks.
Look, I've spoken with the president about it. I reminded him, as I said this morning, this was not a surprise to us. I mean, blue states elected blue leaders. I mean, so what? I mean, it would have been a huge headline if we could have had an upset there, but...
Oh yeah, Trump's days are absolutely normal. His days are absolutely numbered. Absolutely. MAGA they got to get rid of that zombie. That zombie shit got to go away. I can't wait till the zombie shit go away. Because ain't nobody thinking they all on the same page, which tells me they're all zombies because they're all on the same page. Every last Republican say the same shit. They over here caping for rich people. They got scammed. They got scammed out of their money by a rich dude, and the rich dude gave their money to other rich dudes. Now they over here talking about Keisha because Keisha bought a steak for dinner. That's wild. Scared to give Keisha food stamps because she got a steak. But they gave rich men Bay money and Argentina money. That's wild.
But that was to be expected, as Leader Scalise said. I mean, you know, if the three...
I'm amazingly relaxed. Convergence. I never get upset about this shit because I'm hitting the wall with zombies. Every day zombies say the dumbest shit. They all say the same thing. They just say it differently. You Dems are rich. You Dems are goofy. You Dems are Marcus. That's all you hear. The next thing you know, don't be surprised if you see one of the zombies say something about Antifa. Uh-oh, it's coming. Antifa is coming. One of the zombies finna say it.
Big elections yesterday would have been in, Louisiana, Alabama, and Texas. You'd have a totally different narrative, right? Or name any red state. It just so happened that those were the blue states.
I'm not insulting you all. You are zombies. Because all of y'all say the same thing, wealthy white guy. If you read in the chat, you'll notice everybody's saying the same thing as you. All you MAGAs are saying the same thing. When you say the same thing and you believe the same way, that means you guys are zombies. And none of y'all recognize that you're zombies. That's the fucked up part.
That was the blue outcomes. That's what everybody expected. I don't read too much into that. Yes, front row. Morning.
One of them is that we've lost is the looking out the window phenomena. And there's some evidence that looking out.
Okay. But that was the debate for the day. For the day. Cry, cry, cry. We ain't crying. We ain't crying. Why the hell would we be crying? We on a good note. We hot, flying high, brother. We ain't no Democrat that I know upset at all. The message that Donald Trump has put out was rejected by more than everything. We more united than we have ever been before, us Democrats and independents who turned away from Donald Trump in droves. Did anybody get the exit poll? That's what we needed to get. We needed to find out the exit poll information. Did we find out what the percentages were for the Hispanic population? Did we find out what the exit poll said with the independent people? That will tell if this is a good thing going from right to left. Because most people were fair weather voters. They hadn't voted before. They didn't like the direction of the country. They didn't like the food prices were up, gas prices were up, egg prices were up. Nobody liked any of that stuff. Did anybody get any idea where we can find those stats that tells us what the Hispanics did? My understanding is in New York, the Hispanics definitely came out and voted for Mondami. Okay, so here's the thing. Let's hope we can have that same momentum going, the same direction going, but because the Democrats, the maggots, they're gonna vote for the person with the money first. So it is what it is, and that's cool. You're just gonna lose. The Republicans don't have nothing that they stand on. They don't stand for nothing. They don't care about nothing. They don't care about the regular, ordinary, everyday American people. That's the message that we have gotten because Donald Trump said he was going to do America first, and that's not what he's been doing. He burnt up the farmers, burnt them up, burnt up the farmers, burnt up the cattle ranchers, burnt up the American people. I just don't understand how he expects the American people just to put up with this garbage. The whole point is they're not. They said last night that they're not putting up with it anymore. If nobody can unite the Democratic Party, nobody can unite them like that Donald J. Trump. And Donald J. Trump made mistake after mistake after mistake. He's reaching and he's doing things that are illegal. That's why we say we are united in our opposition of this person. I keep telling you all, you maggots, we're not crying. We are not crying. You guys are crying. We're not crying. We're not crying. We as united as we ever were. I don't even get what you think that we're crying at. Don't project. Don't be one of those people. Don't do that. Okay? Don't do that. Most Americans blame Democrats for just overall not getting along, but they really hate the Republicans because they blame the Republicans and Donald Trump for not opening up the government. Because it is Donald Trump's fault and it's the Republicans' fault for not opening up the government. It has nothing to do with the Democrats. And now Donald Trump wants you guys to do the nuclear option. So go ahead and do the nuclear option, Republicans. We tired of playing nice with you guys. We're tired of playing nice with you goofy people who just want to take from the government and get. Y'all gave a scammer y'all's money. The big beautiful bill was a scam to give all the rich people money. You MAGAs gave rich people your money, a scammer your money. You gave a scammer your money, and he gave it to his rich friends. That is wild. That's wild. That's wild. He's still subsidized. Yes, he has to subsidize them from the last time he bankrupted them, Tony. Dummy, Tony. He got to subsidize them again after bankrupting them again. That's wild. Yeah, how about them Epstein files? How about them Epstein files? They scared. The MAGAs are scared to ask about the Epstein files. I can't wait till those come out. I cannot wait till those files come out. We find out whether the president is the pedophile like we think. I cannot wait. They don't, because they're blocking them. They need one more vote for it to be released legally for us to see the Epstein files. Mike Johnson is keeping the House Republicans out of session so he doesn't have to swore a Republican in. A Republican who said she's going to sign for the Epstein files to be released. He doesn't want to go back into session. House Mike is not going back into session because he knows that if the lady comes to get sworn in, she's going to sign the list legally to see the Epstein files. And they don't want that. They want to sweep the Epstein files under the rug where people don't remember Epstein files. But we remember the Epstein files because your president, the orange thug, is in those files, hugging and touching and putting the dick to the other kids. We know that's exactly what he did. So he's on the creeper list. He don't want nobody to know he's on the creeper list. He knows he's on the creeper list. And that's his problem. That's the problem. That is the problem. Release the Epstein files. That's what we got to keep hot. We got to keep saying that, right? Release the Epstein files. Because I'm curious now. See, here's the beauty of it, right? Trump is the one who promised these MAGA people the Epstein files. As soon as he said, you dummies, I'm not going to release anything. You're just a bunch of dummies and stop thinking about the Epstein file. Then they backed up off the Epstein files. You notice that they not hollering about the Epstein file. You know why these maggots ain't hollering about the Epstein files? Because they know he's in them. And they don't want to be embarrassed about their orange thug. We know he's in the files. Release the Epstein files so everybody can see what trash your boss, your maker, your lover, your savior is it. We want to see how far your savior has went to the rabbit hole. We want to see if he done lifted up skirts, specifically 15-year-old skirts. So we're going to keep asking for the file. Oh, I'm not afraid to ask him. I'm not afraid to ask him for the Epstein files, y'all. Y'all want me to write to the Congress and see if they'll release their Epstein files? Y'all want me to write to them and see if y'all can get the files released? Because I'd love to know. I'm helping you maggots out. You maggots said that y'all wanted to see the Epstein file. Now that it's closer and closer and closer to get to see the files, you guys don't want to see the files. Wow. You know they afraid to put those files out there because they know that they boss was lifting up them girl skirts. They know it. Because they know We just got rid of one of those pedos in the Senate, Matt Gaetz, who liked to mess with young girls. He was a House representative messing with young girls. So we know it happens because nobody knew anything about releasing about Biden didn't make no promises, wealthy white guy. Biden never made no promises about the Epstein file. Your Lord and Savior, the Orange Thug, made all the promises about the Epstein files. He's the one who made the promises. Hey, I'll ask him for them. Oh, yeah, I forgot. By the way, how many of you goofies gonna put in the chat, specifically you maggots? How many of y'all can put in the chat what the big beautiful bill did for y'all? What did the big beautiful bill do for you all? Somebody please put that in the chat. Please put it in the chat. Why do y'all think Trump moved, what's her name? Magdalene, what the hell is her name? The chick he took that's in jail. Why do you think she's in a minimum security jail and she got 20 odd years to do? Why do y'all think she's in a young, fresh prison like a freaking place to go and eat and have a good time? They told tax on overtime don't mean jack shit, natural KRC. That means nothing. By the time you get any kind of savings on taxes for overtime, the food will have burnt that all up. He didn't do anything for you when it come to tax on overtime. Every month, the money you spending every month is already burnt up. That tax is already spent. I'm just saying, was it worth it to cape for the rich man? I just don't like the hypocrisy. You come into this chat spewing garbage about the big tax cuts and rich people. No, you come in here talking that foo-foo la-la about Keisha spending my food stamps, Keisha sitting on her ass and not working, Keisha getting my money and not paying back, Keisha living for free. You come in the chat talking about Keisha living for free and you gave your money to a rich scammer. You gave your money to a rich scammer and the scammer gave your money to other rich men. Overtime, tax on overtime means nothing, Black America. That amount is insignificant compared to the freaking groceries that you're going to get. Think of the overtime that you do. Some people just do overtime once a week, 8 hours or 2 hours. That's wild. Anyway, they over here caping for the rich people. That's wild. That's all I'm saying. You over here caping for rich folks, and most of us are poor. That's crazy. Make sure y'all hit that like, that share, that subscribe button. But I still want to know, what did they do for you besides the damn tax on tips? Because that don't mean nothing. If groceries are going up 2 or 3% every month, what money are you saving at the end of the month, at the end of the year? You're not saving anything. You're giving money back. So that ain't no savings. No, Jeff, your Republican Party is in charge now. And you guys gave a scammer the president's job. And that scammer gave your money to other rich men. That's why. Okay, so you do 20 hours overtime every week. So 40 plus 20. Okay, so you get taxed on that 20. Excuse me. but you still have to take into account all the other things that are going up. Jeff, just wild. All right. Now I got to take me a nap. Y'all hit the like and the subscribe button. I know y'all want to hit the hate button. I know you do. But do me a favor and hit the like button. Subscribe to the channel. We have content like this every day. I have the flu. I'm barely hanging in there, and I gotta lay down and take a nap because my head is hurting. So I will be back later at around 10 o'clock, maybe even later. Who knows? I love midnight hour. I love midnight hour streams. I love getting up in the middle of the night and doing stream because there be goofy people up just like me. There be people up in the middle of the night just like me. And I know I can't be the only one that like midnight streams. You know, be on here talking shit. I can't just be the only one. So y'all hit the like button, subscribe button. I'll be back at 10 o'clock. I love all of y'all, but I got to rest my voice, take some more lemon, do what I got to do. Can y'all tell that I got a voice? Can y'all tell that I got a cold? I mean, can y'all tell that I got the flu? Somebody put in the chat, yes, you can tell. Because I can barely, my throat hurt. Barely hurts. Yeah, many reasons Democrat means. Yeah, we use the illegal voters. Are you crazy? Are you crazy? Holla at your girl. Come back at 10 o'clock. Hit the like button, the subscribe button. I love all of y'all. I love this fighting. I love this talk.